So welcome everyone to our first practice session of long clinical consultation batch 30. So this is actually assessment of the homework, and the practice session is a little bit different from other. So how the practice session goes on, we start the practice session by choosing a pair of candidates. One will perform, I will act as a surrogate, and another will observe. At the end of the performance of the candidate, the observer will have to provide the judgment based on each skill. And of course, I will help him. And this will go against vice versa. So let's start with a pair of candidates. Let me see who is there. Dr. Rita, are you there, doctor?
Yes, I'm.
Okay. Dr. Farjana, can you hear me?
Yes, I'm here.
Okay. So first we are starting with Dr. Rita and Dr. Farjana. At first, I will provide a case to Dr. Rita, and Dr. Farjana has to do clear observation. I request Dr. Farjana to have a clear observation of Dr. Rita's performance. And at the end of her performance, you have to provide judgment based on each skill. Don't worry, I will help you.
Okay.
And the things will go again vice versa. Like the next time, you will have to perform, and Dr. Rita will be the examiner, and I will be the surrogate. Sounds clear, doctor?
Yes, doctor.
Okay. And Dr. Rita, the total time will be 11 minutes. After 9 minutes, you will be given signal that you have 2 minutes left.
Okay.
And after getting the prompts, you will have 2 minutes time to take preparation.
Okay.
And don't hesitate. The cases are the cases from the homeworks, no new cases. So, doctor, this is your case. Are you seeing the screen, doctor?
Yes.
Okay. You have 2 minutes time. Take your preparation, and then we'll start.
Okay.
Dr. Rita, my suggestion will be please write down the PDF subject in a blank page and try to ask every questions of past medical history, drug history, and family history.
Okay.
Are you ready?
Yes.
Okay. Dr. Farjana, please keep an eye on Dr. Rita's performance. Your time starts. Proceed, doctor.
Okay. Okay. Hello, ma'am. I'm Dr. Tuhra, one of the doctor today's clinic here. Are you Miss Olivia, 65 years old?
Yes, doctor. I'm Miss Olivia. I'm Mrs. Olivia, and I'm 65 years old.
Okay. So, ma'am, I'm here to talk about your health condition. At the same time, I'll be examining you. Is that all right?
Okay, doctor.
Okay. If any point you have any question, please feel free to interrupt me and ask anytime.
Okay, doctor.
Okay. So, may I know what brings you today here in your own words?
Actually, doctor, I'm having some back pain for the last 2 days. It started suddenly, and I think it is getting worse day by day. I'm not able to tolerate the pain, doctor. Please help me.
Okay, I'm very sorry to hear that. Okay, let's see what can I do. Okay, so how did it started? Is it suddenly or gradually?
It started almost suddenly, doctor. I'm noticing the pain right after getting up from the bed for the last 2 days, doctor.
Okay, okay. So is it first time?
Yeah, doctor, this is the first time.
Okay. Is it increasing day by day?
I think so, doctor. For the last 2 days, I'm not thinking that it is improving. It is getting worse.
Okay. Do you notice anything makes it worse?
I have noticed that I am not able to move my back, doctor, and because movement makes it worse.
Okay, I'm very sorry to hear that. Anything moves, makes it better?
No, doctor, nothing particular.
Okay. If 1 is minimum score and 10 is maximum, can you please score your pain?
Doctor, it is 7 out of 10.
Okay. So right now, are you comfortable to talk with me, or do you need any painkiller?
And that will be very much helpful, doctor, if you can arrange for me some painkiller. Good question, doctor.
Okay, then I informed to the nursing in charge so that she gave you some painkiller. Okay.
Thank you, doctor. That will be very much helpful.
Okay. Okay. So do you have any morning drowsiness?
No, doctor, I don't have any morning journey.
Okay. Okay. Can you show me the side of your pain?
Yeah, patient is showing you her lower back. It is at the end of the lumbar spine.
Okay. 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 So I want to ask you other question that do you have any weakness to your any specific body parts?
No, doctor.
No weakness. Okay. And any tingling, numbness, or any pins and needle sensation to your any parts like leg or hand?
No, doctor.
Any change in sensation into your private parts?
No, doctor.
Okay. What about your water work and back bases? Is there any loss of
It's
control or anything?
no, doctor.
Okay. Okay. But does the pain wake up you at night?
Not particularly that much, doctor. Whenever I take rest, I feel better.
Okay. Do you have any other joint pain?
No, doctor. This is the only pain.
Okay, okay. So do you have any previous medical condition, past medical condition that I should aware of?
Yes, doctor. I have high blood sugar
High blood sugar. Okay. For how long?
for last 5 years.
5 years. Okay. Any high blood pressure problem?
No, doctor.
Any previous diagnosed condition that I should aware of?
Only high blood pressure, sugar, nothing else.
Okay. Any hospitalization previously?
No, doctor.
Any surgery before?
No, doctor.
Okay, okay. 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 Any blood transfusion previously?
No, doctor.
Okay. Any tattooing or piercing or needle shearing?
No, doctor.
Any recent procedure?
No, doctor.
Any recent contact with any sick patient or TB patient?
No, doctor.
Any recent injury to any side of
Yes,
your body?
yes, doctor. 5 days back, while gardening, I had a scratch injury at my leg.
Okay, I'm very sorry to hear that. So, right now, how's the condition of your injury site? Is it healed or is the
Yeah,
persistent
no,
healed?
doctor. It's almost healed, but that was actually I love of gardening, doctor. During gardening, I had some injury to my leg.
Okay, okay, okay. Okay. Can I see your medication list?
Yeah, patient is showing you the medication list. There is only tablet metformin, 500 milligram twice daily.
Other than this, any over-the-counter medication?
No, doctor.
Any medication recently start or stop?
No, doctor.
Okay, are you compliant with the medication?
Yes, doctor. I'm quite compliant.
Okay, any recent dose change of any medication?
No, doctor.
Any allergy to any medication?
No, doctor.
Sorry to ask you, any party medication?
No, doctor.
Any herbal medication?
No, doctor.
Okay, is there any disease that runnings in your family?
Actually, my mother also had high blood sugar.
Okay. Okay. Uh, okay, so do you have any raised body temperature?
Yes, doctor. For the last 2 days, I'm noticing that I'm feeling feverish.
Feverish. Did you record your temperature?
Yeah, doctor. One time I recorded it. I found it was 101 degree Fahrenheit.
Okay. Any chills and rigor with your
Yeah,
fever?
sometimes I feel so, but that is not that severe.
Okay. 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 Do you smoke?
Yes, doctor. I smoke.
Okay. Any amount of smoking is injurious to health, so I would like to advise you to stop smoking. And if you want, I will refer to the smoking cessation clinic. Is it okay?
Okay, doctor. Okay, doctor.
Okay. Do you drink alcohol?
Yes, doctor. I drink sometimes at the weekend.
Okay. Okay. What do you do for your living?
Doctor, I'm a retired lawyer.
Okay. 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 Do you drive?
Yes, doctor. I drive.
Okay. 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 Do you have any hobby to take care of a pet or in your home, any pet?
No, doctor.
Okay. Do you have any long-term partner?
Yes, doctor. I have my husband.
Okay. Sorry to ask you, any casual contact?
No, doctor.
Okay. Any recent traveling to anywhere?
No, doctor.
Okay. 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 What about your monthly cycle?
Doctor, I'm done with my period 20 years back.
Okay. 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 How many childs do you have?
I have two child, doctor. They live separately and they are well established.
Okay. Okay. I want to examine you. At the same time, I will be asking other questions.
Okay, doctor. What want to examine?
Okay. At first, I want to check the site. Is there any redness or any swelling, anything present or not?
Okay. Do you want to expose the site or examine it over the cloth?
With exposure.
Okay. After exposure, there is no visible redness or swelling.
Okay. Okay. And then after hand sterilization, hand clearing, then I want to check the temperature and is there any tenderness present or not?
Temperature is raised. Temperature is not raised. But before checking for tenderness, do you want to take permission?
Yes. Yes.
Yeah. Patient is telling, yes, it is painful, doctor.
Okay. Okay. And do you move your back from forward or backward?
Yeah, patient is able to move forward, backward.
Okay. And side to side?
Yes, patient is able to move.
Okay. I want to do a Shobar test, modified Shobar test.
Okay, no need.
Okay. And okay. And okay. I want to check gait of the patient.
Okay, patient is walking normally.
Normally. Okay. And now I want to check the injury site.
Okay, there is no visible injury site.
Okay. And I want to check the temperature. Is it same as the observation chart or
Yes, it is raised.
raised? Okay. I want to check anemia. Is there any anemia present or not?
Absent.
Absent. And okay. And okay. At first, in eye examination, in anemia, any jaundice or anything present or not?
Absent, doctor.
Okay. In mouth cavity?
No, nothing absent, present.
Okay. And I want to check any palpable lymph node present or not?
Absent, doctor.
Okay. Any peripheral edema present or not?
Absent.
Okay. 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 Do you have any headache?
No, doctor, I don't have.
Okay. What about your skin condition? Any skin rash or any skin thickening or
No,
any?
doctor. 2 minutes left.
Okay. Okay. And okay. Any weight changes? Do you have?
No, doctor.
Okay. Okay. So what's your concern?
Doctor, why I'm having this back pain?
Okay. After talking to you and examining you, I have few possibilities in my mind that you might have a condition. We call it difficulties. Don't bother this medical term. It's actually condition where there is some bug infection occurs in your back. In your back, it's maybe from your previous injury site, And also my another possibilities is it may be your as you have stopped your monthly cycle, it may be due to collapse of the vertebra, but it's a rare possibility. So right now we will admit you, and then we will from a multidisciplinary team. Then we can we can treat you. Do you have any other?
Okay. Hello.
And do you have any other concern?
Doctor, is it curable?
Okay, actually, yes, it is curable. After admitting you, we will give some bacterial medication. Then we hope that it might be cured.
Okay, doctor. Thank you.
Okay, thank
You still have 30 seconds left.
Okay, then can I ask the patient something
Sure,
or
doctor.
something?
Yeah,
Okay.
yeah.
I want to check the pulse and any murmur present or not in the.
Absent.
Okay, okay. And I want to another thing. Do you carry any heavy object or anything?
Yeah. Actually, I love gardening, and during gardening, I frequently
Okay.
carry heavy object.
Okay, then I have to exclude also any disc prolapse present or not.
Okay. Noted, doctor.
Okay. So do you have any other concern?
No. Thank you. Time's up. So, doctor, do you have any diagnosis or differential diagnosis?
Okay, I have some differential diagnosis. My first differential is it may be a case of discitis, and my another possibilities is it may be a case of osteoporotic fracture or disc prolapse.
Okay. So, what are the positive physical findings?
Okay, in positive physical findings from history, she a 65 years old female patient. She had a lower back pain without any red flag sign, and the
Doctor, tell me only the positive physical findings. No, no negative findings. It will happen in the real exam also. They don't want to hear the negative findings.
Okay, the patient has only lower back pain, and also in history, she is a menopaused lady, and she has also in past history she has diabetes for 5 years, and she has also a injury 5 days back. And on drug history,
Doctor, okay. First, understand my question. My question was, what are your positive physical findings? Like after doing the physical examination, what have you got? Not from the history, doctor.
Okay, on examination, there is mild tenderness present, and and movement was mild restricted, and temperature is raised.
Are you sure movement was restricted?
No.
Doctor, please tell it confirm. No, don't tell anything that you are not confirmed, because this would be a trap. This case would be most likely a dummy case in the PACES exam. So the patient will be easily able to move from side to side and forward, backward. And to match your finding of discitis, if you mention this, movement is restricted, surely mark will be gone in one skill. Are you getting it, doctor?
Yes, I'm getting it. So, though the diagnosis is discitis, I should not mention the movement is restricted.
Whatever the findings you have got, whatever findings you have got, just tell this honestly.
Okay, okay.
Then, doctor, anything else apart from tenderness?
Okay, and temperature is also raised.
Yes. Anything else?
No.
Any other positive findings?
And injury site.
Okay.
No.
This is again trap. Sometimes examiners will poke you to synthesize finding. Any other findings? Any other findings? To see if you fall into the trap. To synthesize any positive finding. Are you getting it, doctor?
Okay. Yes, I'm getting it.
So be confident about your finding. Don't synthesize any finding, because many candidates just miss the pass mark only for synthesizing finding and falling into this trap. Now tell me, doctor, how will you like to investigate?
Okay, apart from basic investigation, I want to do X-ray X-ray of the back, lumbosacral spine, and also after that, after that I want to do also MRI of the MRI of the lumbosacral spine, and also in blood also in blood test, blood culture, sensitivity test, and in complete blood count, ESR and CRP.
Okay. Why MRI, doctor?
To exclude other things like any disc prolapse present or not.
So, do we go for doing MRI with any disc prolapse at the first?
No. At first, I want to check X-ray, fine. Then, if inconclusive or anything present, then.
Yeah. Actually, doctor, in the PACES exam, don't mention the MRI unless there is cord compression or suspicion of metastasis.
Yeah. Okay.
So, it would be wrong. Like for any discitis, initially will not go for MRI. After doing the X-ray and blood culture, we'll proceed accordingly.
Okay.
Then how to manage?
Okay, in management purpose, as the patient has high temperature, so I will admit the patient and then I have to manage airway, breathing and circulation. And then for treating underlying cause, I want to give antibiotic.
Yes. What kind of antibiotic you want to provide?
Okay, want to give antibiotic according to the local guideline. For that, I want to talk with my team and infectious disease specialist.
Good answer. That question I provided. Like I got a case of meningitis and the British doctor asked me what antibiotic you want to start. I just provided the same answer that I want to talk to the infectious disease department. We don't have to memorize the name of the antibiotics there. Your performance was absolutely fine, doctor. Considering the first time, you were absolutely good. Now let's dissect your performance one by one. Dr. Farjana, are you there?
Yes.
So this is the mark sheet. In this mark sheet, the prompt will be written like this: low back pain. And the diagnosis will be written in the bracket like this, discitis. So based on Dr. Rita's performance, what is your judgment for physical examination? Dr. Farjana? Yeah.
In physical examination, she did everything, but I think she can ask for plantar.
Yes, she did not check the plantar.
She can ask for plantar and
not for asking. We have to do this, doctor.
yes, and
Why
also
plantar?
also as the patient has fever, so to spread out the fever anywhere else, she can check. She could check the base of the lung for any pleural effusion or not.
Okay, actually, in the PACES exam, they don't expect this kind of complicated scenarios. This will be very straightforward. She starts for the site of injury. That is okay. And this would be a dummy case. Any real discitis patient will never be given in the PACES exam. Are you getting it, doctor? I hope you understand.
Yes.
You are telling that due to the spread of the infection resulting in pleural effusion, that is very rare. In the PACES exam, we are being assessed to perform at ST3 level, not at ST8. We are not being judged as a consultant there. We are being judged as a registrar. That's why they try to maintain a standard of case. Are you getting it, doctor?
Yes.
So anything else?
No, I think she did everything, pulse, blood pressure, and tenderness, everything she did.
So can you please explain in your own word the CCCA for this physical examination? First, to confirm the diagnosis.
Confirm to find out the cause and to find out the complication.
Yeah. So Dr. Rita done absolutely well. Can you please elaborate what physical examination we have to do to make it clear to other candidates? To confirm the diagnosis of this low back pain, what examination we have to do first?
She can to look for the injury site.
Actually, the prompt is low back pain. Our diagnosis is discitis. So first we have to examine the lower back in the form of look, feel, and move, which Dr. Rita did absolutely well. First, after doing proper exposure, she had a proper look. And during looking, please do the acting that you are looking carefully, looking for any redness, looking for any swelling, which will be absent there. Then we have to feel the lower back. First, we have to check the temperature. Then we have to ask the patient, do you have any pain here? If the patient complains of pain, stop your examination and ask the examiner that patient is feeling pain. I want to check the tenderness. Should I proceed or not? Then if the examiner permits you that proceed, then probably the surrogate of the patient would be instructed that whenever the doctor is going to press over your lower back, just mention that I'm feeling pain. Is it clear to all? Dr. Farjana, are you getting it?
Yes.
Please mention this thing. Anytime, any pain, suspicion of pain, don't go for examining the patient. First, ask the patient for pain, then take permission from the examiner. Because if at any time the patient screams out of pain, you can be sure that you are failed. So be careful about that. Always ask for permission before eliciting tenderness. Then you have to check the move, which Dr. Rita wonderfully did. We have to check the movement of the lumbar spine in full play, side to side, forward and backward. Absolutely wonderful. So these are the examinations to confirm the diagnosis. Then to find out the cause. What is the cause, Dr. Farjana?
Cause was the infection from
Yeah.
the injury?
Yes. For that, Dr. Rita searched for site of injury. This would be a dummy case in the PACES exam. So she just has to do some acting of checking the leg to look for the site of injury, but she will not find it. And we have to do the acting in front of the examiner, showing them that we are looking for the site of the injury. Then what are the examination? Look for complication. Dr. Farjana?
For complication, she has already asked the red flag signs. There was no complications.
Yeah,
And
from physical examinations.
from physical examination,
What
any
complication can
movement
happen?
restrictions
Yeah.
and
Also, anything else?
and plantar of any
Yes.
long
We
yes,
have to rule out cord compression.
cord
First from the
compression.
history, then from the physical examination. From the physical examination, actually, it is better to examine the lower limb neurologically. But if you don't get the time, it is enough to check the plantar only. No need to examine all the things like tone, power, reflex, coordination, sensation, because this would be a dummy case. The examiner will see whether you are checking the plantar or not. Excuse me, doctor, some background sound is coming. Can you please, doctor, mute it? Then for any type of low back pain or knee pain or ankle pain, we have to check the gait. If it is hand pain, we have to check the function and capacities of the hand. And Dr. Rita wonderfully did all the things. Clear, Dr. Farjana?
Yes.
And for association, for this case, there is no physical examinations. So we can skip this part. So if you follow this pattern of CCCA for every physical examination, you will not miss any important part of examination. There are two ways of doing examination, that doing some general examination first, then doing the other examinations. But sometimes you will miss some important part of examination if you follow that general approach. And my suggestion is, before starting for every examination, always offer to check bedside vitals in the form of pulse, temperature, respiratory rate, oxygen saturation, then sitting and standing blood pressure. Do this for every patient. And if you find any abnormality here, you can be sure inside your mind that we have typed with the patient. For this patient, the temperature was high. That's why Dr. Rita admitted the patient. Now tell me, Dr. Farjana, what is your judgment?
No. I think she got 3 out of 4.
Actually, doctor, let me tell you again. This is the mark sheet from one examiner, not both. So you are working there at one of the examiner, and you have 14 marks at hand. For each skill, you have 2 marks, not 4 marks, doctor. Are you getting it? If it is
Sorry, I don't.
satisfactory, okay. So
Okay, satisfactory.
yeah, it is satisfactory, then she will get 2 marks from your side. You don't
Oh,
have the power to provide 4 marks because there will be 2 examiners. Both the marks will be submitted. So in this practice session, whenever you will do mutual practice, you have to practice like this way. Later on, you can multiply it into 2. But you have to understand that every examiner has the power of providing 14 marks in total, not the 28 marks. Are you getting it, doctor?
okay.
So only thing was plantar was missed. This is a little mistake. I hope this will be overcome. Then identifying physical signs. This was a dummy case. The patient was instructed to mention that she is feeling tenderness whenever the doctor is going to press the lower back. And Dr. Rita wonderfully elicited that. No other positive physical findings are there except for raised temperature. So, Dr. Prajana, what is your judgment for identifying physical signs?
She will get satisfactory.
Yes, it is again satisfactory. Now come to the clinical communication skill. Please tell me,
Satisfactory.
are you sure?
I think she asked most of the questions, just the systemic questions. Some questions she missed, like any. I think she did well.
Okay. Did she ask the infection?
No,
How this symptom is affecting your daily activity?
daily life.
Do you think it is important?
It's important.
Why? Can you explain it?
Because in that case we can arrange social support or occupational
Yes.
health care.
Yes, doctor. Because we are performing there as a safe doctor. We don't have to treat the patient only. Even whenever she's going back to home or whenever she's having some problem, we have to contact with the respective department to arrange for the support. And this is a must to ask for every patient, that how this symptom is affecting your job and daily activity. If the patient is in job, we have to mention the job. If the patient is retired, then we just have to mention daily activity. All the things were provided in this PDF sheet. We have to ask this PDF subject. That's why before starting, I requested Dr. Rita to write in a blank page this PDF subject name, because I have seen from my experience that candidate most often miss this part. And you can be sure that for missing this part, you will lose your mark.
Actually,
clinical.
I wrote this, but as he was she was retired, so actually
Sorry? Sorry, some background noise sound is coming. I don't know.
I told
Yeah.
that actually, yes,
Yes,
I
doctor.
wrote actually yes, I write this also in a blank page, but actually I somehow confused that she was a retired person. So could I ask it or not?
Yeah, that's why you have to ask only the daily activity, not the job. If she was in job, then you have to mention job and daily activity. Because if she is having problem in job, you have to refer her to the occupational health department. If she is having problem in daily activity like dressing, cooking, bathing, in the UK, they arrange social health. It's called social service. And there is an easy term for all. In the PACES exam, if you forget the name of the department, just mention respective department. Are you getting it, Dr. Rita?
Yes.
So don't worry. Comparing the first performance, this is absolutely okay. But sorry to say, this impaction for not asking this question, it will surely affect your mark.
Oh, good news.
So, Dr. Farjana,
ছিল তোমার ছোটবেলার টাইমটা আমার এত পছন্দ তো ভালোবাসছে আমার
Dr. Tushmita, can you please mute yourself, doctor? Because the sound is coming. Okay. Yeah, Dr. Farjana, can you please
Yes.
tell me anything else?
I think she performs all the communication part, but
Yes.
systemic questions she didn't ask. I think don't need maybe
Actually, in
systemic
the PACES
question.
exam, in the PACES exam, we don't have to ask all the systemic questions all the time. It is not mandatory.
Yes.
The mandatory thing is whether she is asking the relevant questions. Like the patient is not having any breathlessness. So if you miss that, are you having any cough, any shortness of breath? That is not actually essential. If you ask, that is okay. But even if you miss it, if you just touch the PDF Sajid and relevant screening question of the differential diagnosis and the question of that particular system, like this is the musculoskeletal prompt. So at least we have to ask the systemic questions of musculoskeletal system that Dr. Rita asked.
Everything.
So are you clear about this, doctor? How to ask, do you have any confusion? Like for every patient, we don't have to ask all the systemic questions.
Okay.
You can skip that. It is not mandatory. But if you miss any part of this, mark will be sure cut. So my suggestion is, if you follow the flowchart, after doing introduction and symptom analysis, complete the PDF study. Then if you have some differential diagnosis from this course, or if you can make it, just ask the screening question. Then if the time allows, you can go for systemic review. This is optional. But for all the patient, at least ask the systemic question, that is fever, loss of weight, loss of appetite, which Dr. Rita asked. But other systemic questions are not mandatory. Most of the time, you will not get enough time to complete all of them.
I have a question.
Sure, doctor.
Okay, should I ask about diabetic question as she was diabetic for 5 years, but
No,
I'm
just have to ask, are you compliant with your medication that you have asked? Are you compliant with your diet, track, and daily exercise? If the diabetes is more than 10 years for type 2 and more than 5 years for type 1, then we have to ask that all the complications of diabetes, like the microvascular. This microvascular, first we have to assess the complications. One is short-term complications and then long-term complications. Long-term complications are microvascular, macrovascular, and autonomic complications. Otherwise, it is not mandatory because he will not get enough time and he will not get any positive findings. Are you clear about that, Dr. Rita?
yes.
So actually, this clinical communication skills needs a lot of effort. You will not be able, like for all the other skills, you need little effort, but it is actually a vast part. And some parts, if you miss it, you lose the mark. But Dr. Rita is wonderful that she offered painkiller. She took the history of low back pain in wonderful and professional way. That was absolutely beautiful. But she missed a vital part. That is impaction on job and daily life, which is actually important for UK doctors. So Dr. Farjana, now tell me, what is your judgment for clinical communication skill? Is it satisfactory, borderline, or unsatisfactory?
For me, it's satisfactory.
Yeah, for you it's satisfactory, but truly it will be borderline. Only for missing impaction on job and daily life.
Okay.
And I will suggest you that whenever you will do mutual practice, please do the judgment as crucial as you can, because you are helping each other. In this scenario, I'm just showing you how to do mutual practice using the course materials. It's not like that she has to get full marks. So it would be borderline, only for missing impaction on job and daily life. Otherwise, it was perfectly okay. Now come to the differential diagnosis. She mentioned all the required differential diagnosis.
Yes.
So what is your judgment?
Satisfactory.
Yes. Clinical judgment was absolutely okay. She admitted the patient. She mentioned the required investigations. MRI, she mentioned it. It is also okay. It is not a major mistake for mentioning MRI. And management was also okay. It is an acute case. So any type of acute case, as you have seen in the physical examination video, after admission, we have to manage the airway breathing circulation, which Dr. Rita wonderfully mentioned. Then education and counseling, forming a multidisciplinary team, and treatment of the underlying cause. So what is your judgment, Dr. Farjana?
Satisfactory.
Yes, satisfactory. Now concern management?
Satisfactory.
Yes. And welfare, we cannot assess it on online. The trick to get a full mark in welfare is not to cause any pain to the patient. Whenever patient is complaining of pain, whenever you are checking for any tenderness, always ask the patient, do you have any pain there? And if the patient complains of pain, please don't go with the examination unless the examiner permits you. Take permission from the examination, because it has happened for multiple times that the candidate started examination and suddenly the examiner, the patient just screamed out that with a sound that, I'm feeling pain. And you can be sure that if the patient screams at any point, you are surely gone at that station. Welfare will be zero. And there is another suggestion that whenever you are done with your examination, please say thank you to the patient. If possible, say it 3 times and do the handshake with the patient. So like, thank you, doctor. Thank you very much. You have done a wonderful job for me. And help the patient to put on the dress. Whenever you will help the patient to put on the dress, the surrogate will instantly come and take the job from your hand. But all this body gesture will give a positive signal to both the examiners that this doctor is empathetic and professional. And you will gain full mark in welfare session. Dr. Dura, the differentials are discitis, then disc prolapse, then osteoporotic fracture. She is postmenopausal. These are the 3 differentials. In the past medical history, she had history of recent injury. Another wonderful thing is that Dr. Rita asked all the past medical history in detail. And surely in the PACES exam, if you don't ask for any recent injury, he will never give you the history. That's why we have to know all the questions, what questions we have to ask for past medical history. Because the surrogates are instructed in such a way that if you ask about past medical condition, he will not give you the answer whether he had any surgery or not. So you have to memorize this from the PDF. So Dr. Farjana, if we calculate all the marks from one examiner, what will be total mark out of 40 from each of the examiners separately? Dr. Farjana?
20,
No.
20,
Out of 40,
20.
let me tell you, satisfactory is 2.
Okay, 2.
There are 6 satisfactory and 1 borderline. Borderline is 1. So suppose you are one of the examiners. Yeah. So what is the total mark? 13.
Yeah.
Then during mutual practice, you can multiply the mark into 2. Just guessing that both the examiners have provided the same mark. Then it would be 26 out of 28, which is actually a very good mark for the first practice session. Because in this course, I have seen a lot of candidates starting with 8 out of 28. And whenever the session was about to complete, they used to get 28 out of 28. This is just a matter of practice, nothing else. And Dr. Rita's performance was absolutely beautiful. Only trivial mistake was there. I'm just warning you not to make the same mistake again and make it a reflex that every time you ask how this symptom is affecting your job and daily activity. Are you getting it, Dr. Rita?
Yeah.
Do you have any question or confusion from this scenario?
No.
Okay. So that's all for your term. Now it starts the term of Dr. Farjana. Now I will provide a case to Dr. Farjana, and this time Dr. Rita will be the examiner. I will be the surrogate. Is that okay, Dr. Rita?
Yes, okay.
Okay. Let me select the case for Dr. Rita. So, Dr. Farjana. Dr. Farjana, this is your case. Are you able to see the screen, doctor? Hello?
I can see.
Okay. You have 2 minutes time to take preparation.
Okay. I can start.
Okay, doctor. Let's start. Proceed, doctor.
Okay. Hello, I'm Dr. Mahmood, one of the doctors of today's clinic. May I confirm your name and age, please?
Doctor, I'm Mrs. Laura. I'm 40 years old.
Okay. Good evening, Miss Laura. Today we are here to discuss about your health condition. During discussion, I will take history as well examine you and make some notes. Be sure that will be confidential. Is that okay with you?
Okay, doctor.
Okay. Can you tell me what brings you here today?
Doctor, I'm having some hand pain for last 1 month. It is getting worse day by day. I think I really need some help from your side. Please help me,
Okay.
doctor.
I'm sorry to hear about your suffering. Um, can you tell me what you mean by hand pain?
Like what you want to know?
Is that pain, is that any joint pain or
No,
pain
doctor.
in the whole hand?
It's not
No
joint
joint
pain.
pain.
No.
So, okay. So, is that something like that your hand change color in weather during exposure to cold?
Yes, doctor. It is.
Okay. So, is the color changes like pale blue, then red?
Yes, exactly. You are right, doctor. It changes its colors like this.
Okay. I'm sorry to hear about. With this, you have also pain, right?
Yes, doctor. Right now,
How
I'm not.
it's
Right now, I'm not having the pain. But whenever I go to any cold weather, I feel the pain most,
Mhm.
doctor.
How it started?
It started suddenly, doctor.
So is it increasing day by day?
I think so, doctor. It is becoming unbearable.
Okay. Do you have any joint pain anywhere other
No,
than this
doctor.
hand pain?
No, doctor. I only have
No.
this color change. When the pain comes, whenever
Oh,
the color is changing.
okay. So, have you ever noticed any blackening of your skin anywhere?
I have to notice, doctor. I'm not sure about that.
Okay. Um, so, may I know that with this hand pain, do you have any rash anywhere in your body?
I'm not sure about that, doctor.
Okay. Any skin thickening?
Yes, doctor. I have skin thickening.
Okay. Do you have any problem with getting up from sitting posture?
No, doctor.
Okay. Any dryness of your eye?
No, doctor.
I'm sorry to ask you the private question. Any soreness in your private part?
No, doctor.
Any hair loss?
No, doctor.
Any oral ulcer, oral
Uh,
soreness?
Good question. No, doctor.
Okay. May I know, do you have any problem with your breathing
No, doctor. I
and
don't have any.
shortness of breathing?
No,
Any
doctor.
problem with your swallowing?
No, doctor.
Okay. So any racing pacing of your heart?
No, doctor.
Any cough?
No, doctor.
Any past medical history I may aware of?
Doctor, I have high blood pressure for 3 years. And also I have some anxiety disorder. For that, I am taking treatment.
Okay. And can I see your drug list?
Yeah. Patient is showing you the drug list. Here it is mentioned. Tablet losartan potassium, 40 milligram once daily. Tablet citalopram, 5 milligram once daily. And tablet propanolol, 10 milligram thrice daily. 3 times daily.
Okay. And are you compliant with your drug?
Not drug, it will be medication. Drug is only the party drug. Yeah, doctor, I'm quite compliant with my medication.
So, is there any addition of new medication or omit of any medication?
No, doctor.
Okay. I'm sorry to ask, any party medication you are
No,
taking?
doctor.
Okay. Any positive family history, like similar kind of disease in your family?
My mother used to have high blood pressure.
Okay. Um, any raised body temperature?
No, doctor.
Any lumps and bumps?
No, doctor.
Any weight changes?
No, doctor.
Any weather preferences?
No, doctor.
Okay. What do you do for a living?
I'm a housewife, doctor.
How much is it impacting your life?
Yes, doctor, it is impacting a lot. Even whenever I do some activity with my cold refrigerator, I feel the pain very much. Even I feel difficulty in doing gardening, doctor.
Okay. I would like to suggest you to avoid the cold weather and put gloves whenever you do in something in cold weather. And we will help you with our occupational health worker team to help you in this regards. Is that
Okay,
okay with
doctor.
you?
Okay,
Okay. Do
doctor.
you smoke?
No, doctor, I do not smoke.
Okay. Do you drink alcohol?
Actually, sometimes I drink.
Okay. And do you drive?
No, doctor, I do not drive.
Okay. And I just want to know that some personal question. Are you sexually active?
Yes, doctor, I have my husband.
Okay. Um, is there any effect on your sexual life?
No, doctor.
How many kids you have? Do you
I
have
have
any kids?
I have one kid, doctor.
Any loss of pregnancy, maybe?
No, doctor.
Okay. And are you on birth control pill?
Yes, doctor, I take it.
Okay. For now, you have to stop the birth control pin. We will tag you to our woman doctor that will review your medication and will switch to some other medication maybe. Okay. Is that okay
Okay,
with
doctor.
you?
Okay, doctor.
Okay. Okay. And may I examine you?
Sure, doctor.
Okay. I want to start from the patient's hand. I will
Okay.
look the hand. So I will ask any tenderness.
Absent?
Absent. So I will just feel the patient's joint. Is there any
No tenderness is present.
notice? Okay. I want to ask surrogate for capillaroscopy.
Bedside capillaroscopy. Okay, noted, doctor.
Okay. I
Anything
will
else?
check for any soreness, ulcer, or calcinosis.
Yes, ulceration is present at the right fingertip, right hand fingertip. And calcinosis is
Oh,
also present.
okay. And I will ask patient to pinch her uh, forearm and also arm to
Okay.
see the
Skin
thickening
skin thickening is present below the forearm, below the elbow.
below the elbow. Okay, thank you. And I would like to check the patient's proximal myopathy
Absent.
by, okay. And then I will want to check patient's blood pressure
Same as given outside.
and pulse.
Same as given outside.
Okay. I will look for patient's face and ask patient to open the mouth
There is thickest mouth opening.
Okay, diffuse mouth opening. And also look for the eye. Is there any dryness or redness?
Absent, doctor.
Okay, I will go for the neck to see any salt and pepper
Rash,
rash.
present.
Okay, salt, pepper rash present. And then I will go for patient's precordium to
Okay.
see I'll look for any pulmonary hypertension present or not.
Absent. Absent.
I will go for the base of the lungs to check for any
Yes, doctor.
normal.
Proceed, doctor. Yeah, based on the line, normal.
Normal. So sorry, I want to check patient's leg swelling.
Absent.
I want to check patient's urine deep test and fundoscopy also.
Okay, fundoscopy noted. Yeah.
Also look for hair. Sorry, I missed that. Also look for hair or any discoid lupus or anything.
Okay, absent, doctor.
Okay, and so
2 minutes
do you
left.
have any tummy pain?
No, doctor.
Any how about your back passage?
It's normal, doctor.
How about your waterworks?
It's also okay.
Is
Doctor,
there any change
2
of
minutes is
amount?
left.
Okay. So may
Yeah.
I know what is your concern?
Doctor, why I'm having this hand pain?
Okay. After talking to you and examining you, there is a possibility that you have a condition that is called Raynaud's phenomenon. Don't bother about the medical term. It's a condition where our small blood conduits of your hand is narrowed, and that's why you are having problem like this whenever you are going to the cold weather, you are having pain and your hands is changing color. And for this reason, there is a cause that is called systemic sclerosis. uh, uh, and it is a condition of misdirected defense system, where your body is supposed to act against the foreign body. Here it's against works against your own blood channels and muscles and bones, and that's why we're having this kind of symptom. Are you getting me?
Yes, doctor. Doctor, is it
So
curable?
but I'm sorry to say that it's not curable, but it's controllable. We are going to form a multidisciplinary team and going to run some tests, and we'll get back to you with the proper management. But for now, I would suggest to tell you that to stop the birth control pill and also the tablet taking beta blocker.
No,
You
no.
have to
What utter the name, doctor? Beta blocker is a jargon.
propanolol.
Yeah, okay.
Okay, you have to stop those medication,
Okay,
and
doctor.
and we are going to keep you under
Thank you,
our
doctor.
observation.
Thank you, doctor. Time's up.
Welcome. Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
My diagnosis is Raynaud's phenomenon due to systemic sclerosis.
Okay. So, what are the positive physical findings?
On physical examination, I found patient has a right hand ulceration and calcinosis, and also there is proximal skin thickening, and there is a reduced mouth opening, and there is salt and pepper lesion in her neck region, and I could not appreciate any other positive findings. And patient's blood pressure is raised.
Okay. What of the facial appearance?
Sorry, patient's facial appearance is it's what to say stiff,
Okay.
pinched nose, and
Okay, doctor. Anything else? Okay. So, how would you like to investigate?
I would like to do the apart from basic investigation, I would like to do the patient's ANA, anti-SL70, anti-centromere antibody, and also do the patient's renal profile, including uh, urinary microalbumin, and also want to do patient chest X-ray and endoscopy. I have said in this.
Yeah, you have mentioned. That's good,
Okay.
doctor. So how to manage?
Uh, First, I will patients educate the patients about the disease, patients counseling, and forming a multidisciplinary team. And I will give the patients management about the hand to avoid cold exposure and using hand gloves and avoid the using vibrating machines and
Yes.
tools. And for the pain, I will give the pain management. In this case, I will give patients NSAIDs and also calcium channel blocker, and
Okay.
also refer the patient rheumatologist for further management.
Yes. That's all. First, you have to mention the management of Raynaud's phenomenon. Then you have to arrange the referral to the rheumatologist.
Yes.
Yeah, that's all. So, doctor, just to mention, are you hearing any background sound from my side?
No.
Okay. That's good. So, doctor, your performance was absolutely beautiful. So, Dr.
Thank you.
Rita, are you there?
Yes, I am.
So, the case is hand pain due to Raynaud's phenomenon. Regarding physical examination, what is your judgment, doctor?
Did she check proximal myopathy?
She has checked it.
Then I am satisfied.
Yes, doctor, it was satisfactory. It was actually a difficult case. And wonderfully, in the first session, Dr. Fajara has cracked it. Then identifying physical signs, Dr. Fajara identified all the positive signs.
Yes. Yes. So it's also
So,
satisfactory.
yes, it is also satisfactory. Now come to the clinical communication skill. What is your judgment for that?
Okay. Okay. Did she ask? Actually, I don't know that. Is it ask about any use of any vibrating tool? Should we ask that in Raynaud?
No, better to I gave the information from myself that I love gardening, and she asked about hobby.
Yes. Okay. Okay. Other than this, actually, all are okay, I think.
Yes, she did absolutely okay. So, what is your judgment then?
Satisfactory.
Yes. Then differential diagnosis?
It's also satisfactory.
Yes, Doc. Now come to the clinical judgment.
I think it's also satisfactory.
Yes, doctor, it's also satisfactory. She mentioned the safety netting, like she mentioned to stop the propanolol and also the OCP. That will be counted at clinical judgment. And she mentioned the investigation and management in the most professional way.
Yes.
So safety netting was ensured, like avoiding the OCP and propanolol, and wear gloves. And investigation and management were also mentioned.
Yes.
Now come to the managing concern.
It's also satisfactory.
Yes. And welfare? Welfare management?
Yes, it's also satisfactory.
It's considered satisfactory. So good job, Dr. Farjana. At the first session, yes, Dr. Rabia, there is only one DD for this case. It is Raynaud's. There are not multiple DD. The patient was systemic sclerosis patient. So good job, Dr. Farjana. Dr. Rita.
Thank you.
So Dr. Rita, what is the total mark out of 14 from each examiner?
14.
Yes, 14. And this is very rare, actually. According to my experience, actually candidates very rarely can get 28 out of 28, even at the first session, which Dr. Farjana has got. Good job, Dr. Farjana.
Thank you.
You're most welcome. Do you have any question from this scenario?
No, not at all.
Okay.
Actually, I have practiced and
Yeah, it
I
reflects.
think
Dr.
it
Rita
came
has
on
also
me.
practiced. Yes, doctor.
Yes, okay. Thank you.
So to other candidates, just to mention, it is not actually some blind approach, like I'm giving some random cases. In our prompt session, we have already discussed approaches to each of the prompt that comes in the PACES exam from this musculoskeletal system. We have discussed in detail how to take history for hand pain. Then each candidate was provided with a sets of cases. This is the PDF, this is the case note. This case number 1 to case number 33. These are cases from the musculoskeletal system. And apart from this, there was a separate video access there mentioning the physical examinations, investigations, and management for each of the cases separately. Yeah, these are the videos. Here in these videos, for each case separately, what physical examinations we have to do, what investigations we have to do, and what management we have to do. This has been explained elaborately. So each candidate was given homework. After taking preparation, they had to practice mutually. And in this session, actually, I'm assessing the homework, nothing else. It is not a blind approach. And please, doctors, during your mutual practice, after the case note, how it is written, you have to take your information from this. Just a minute, doctor, I'm having some excessive noise from my surrounding. I'm just coming back. Just pause. So actually, during your mutual practice, you have to use these case note details to perform as a surrogate like me. Like for this case, this was the case of Raynaud's phenomenon. All the things are written in there. The way it appeared at the real basis exam. All the things, how she was presented, what was the past medical history, drug history, family history, what was that in the family smoking, alcohol, job, and what was found in the physical examination. So using this information, you can practice mutually. So from now on, Dr. Farjana has to practice with Dr. Rita, and Dr. Rita will have to practice with Dr. Farjana using this material, like this way. Are you clear about that, Dr. Farjana and Dr. Rita?
Okay.
Yes.
Dr. Rita, are you clear how to perform like a surrogate? All the things are written here. You can just act the surrogate using the information mentions here.
Okay.
Okay. Thank you, doctor. Now let's proceed to the next pair of candidates. Actually, many doctors thought that it is actually free practice session. It is actually not like that. The registered candidate has been provided with homework only for type 1. And for this batch, actually, no type 1 slots are left. And I'm assessing the homework from that provided homeworks. Nothing else. Now let's proceed to the next pair of candidate. Dr. Fariha, are you there, doctor?
Yes, I'm here.
And Dr. Asmaul Husna Preeti? Dr. Preeti, can you hear
Yes,
me?
I'm here.
So right now, Dr. Fariha will be the performer and Dr. Preeti will be the examiner. And I will be the surrogate. So I'm going to give a case to Dr. Fariha and Dr. Preeti will give the judgment. So let me pick up a case for Dr. Fariha. So, Dr. Fariha, this is your case. You have 2 minutes time to take preparation. Are you able to see the screen?
Yes.
And my clue is please write the PDF Saji in a blank page and ask all the questions, not to miss anyone. And also write how to approach to a case of low back pain, what we discussed in our prom session. So, Dr. Fariha, are you ready?
Yes.
So you can start. Start, doctor.
Hello, I'm Dr. Fariha, one of the working doctor in the clinic today. Am I talking to Mr. Harry, 25 years old?
Yes, doctor. I'm Mr. Harry. I'm 25 years old.
Okay, Mr. Harry, I am here to talk to you about your problem and examine you. Is that okay?
Okay, doctor.
If at any point you have a question, please feel free to ask me anytime. And during our conversation, I may take a few notes and be assured everything will be confidential between us.
Okay, doctor.
So can you please tell me, Mr. Harry, what has brought you to our clinic today?
Doctor, I'm having some low back pain for the last 10 days, doctor. It is getting worse day by day. I think I need some help from your side. Please help me, doctor.
I'm so sorry to know about your sufferings. Let us see if how can I help you in this regard. So, can you please tell me that where is the location of your pain?
Patient is showing at the lower end of the lumbar spine, especially the lumbar vertebra.
Okay. Can you, in your own words, can you please tell me how will you rate the pain from 1 to 10, 1 being the minimum and 10 being the maximum?
It is 5 out of 10, doctor.
Um, uh, so, um, what is the nature of the pain? Like,
It's dull pain, doctor.
okay. From your lower back, does it radiate to anywhere?
No, doctor.
Okay. So, Mr. Harry, do you have any past medical condition that I should be aware of?
No, doctor. I was completely all right.
Okay. Do you have any history of surgery before?
No, doctor.
Any hospitalization
No,
before?
doctor.
Do you have any history of blood transfusion or
No, doctor.
tattooing?
No, doctor.
Do you have any history of dental procedure
No, doctor.
or any recent infection you have been suffering from?
No, doctor.
Do you have any history of contact with sick patient?
No, doctor.
Do you have any recent renovation at home?
No, doctor.
Any recent injury you have been suffering from?
No, doctor.
Can you please show me your medication list, Mr. Harry?
I don't take any regular medication, doctor.
Okay. Okay. Are you okay? Are you allergic to any medication?
No, doctor.
Okay. I'm sorry to ask you. Do you take any party drug?
No, doctor.
Any herbal medication?
No, doctor.
Any over-the-counter medication?
No, doctor.
Okay. Do you have any disease running in your family?
No, doctor, not significantly. All are okay.
Okay. Are you have been suffering from any high body temperature?
Yes, doctor. Sometimes I notice my temperature becomes high.
Have you recorded your highest temperature?
Yes, doctor. I recorded it once time. The highest recorded temperature was 101 degree Fahrenheit.
Okay. Do you feel tired?
I feel very much tired, doctor. Especially whenever the fever breaks down, I feel very tired.
Okay, so sorry to know that. Have you noticed any weight change?
I think so, doctor. I'm losing some weight.
Okay. Is your appetite okay?
No, doctor. I feel low.
Okay, so can you please tell me how much weight you have lost?
Actually, doctor, I think I have lost about 2 kg weight in the last 15 days.
2 kg weight in last few days.
Yeah,
Okay.
15
So,
days.
do you have any sweating?
Yes, doctor. I have profuse sweating, especially at night. And whenever the fever breaks up, it has excessive sweating and some musty odor, I feel.
Okay, so sorry to know. Do you have any lumps or bumps anywhere in your body?
I did not notice, doctor.
Okay. I'm sorry to, I'm going to ask you that, do you have any recent travel history?
Yes, doctor. 1 month back, I traveled to my father's cattle farm.
Okay. For how long you have stayed there?
I stayed there only for 3 days.
Okay. Okay. Any contact with, okay, you have direct contact with the cattle there?
Yes, doctor. I had direct contact there. I used to drink the milk there. It's my father's own cattle farm, doctor.
Okay. Okay. So I'm sorry to ask you, do you smoke, Mr. Harry?
Yes, doctor, I smoke.
So how many cigarettes for how many?
About 10 cigarettes per day for the last 10 years.
I'm going to tell you that smoking is very injurious to your health. If you want, I can refer you to a smoking cessation clinic. Is that all right?
All right, doctor.
Do you drink alcohol? I'm sorry to ask.
I drink socially, doctor.
Okay. So may I know what do you do for your living?
I work at a corporate office, doctor.
Okay. Is your the recent symptoms affecting your job life?
Yes, doctor. For this low back pain and also the fever, I'm not able to join my job for the last 5 days.
So sorry to know that. I'm going to refer you to occupational healthcare department and they will help you in this regard. Is that okay?
Okay, doctor.
And is your symptoms affecting your daily life?
Yes, also, but I'm managing it somehow, doctor.
Okay. In that case,
Thanks for asking this question.
okay, our social healthcare department can also help you in this
Okay,
regard.
doctor.
Do you
Okay,
drive,
doctor.
Mr. Harry?
Yes, doctor. I drive my own car.
Okay. I advise you to stop driving until further assessment. Is that okay?
Okay, doctor.
Okay. I want to examine the patient.
Okay. What do I want to examine?
At first I want to know the vital signs of the patient.
Same as given outside.
Okay. I want to examine the spine and the area in the sitting position.
Okay. After exposure or not exposure?
After proper exposure.
Okay.
Yes.
What you want to do?
At first I want to inspect if there are any visible deformity, any
Absent.
redness.
Absent.
I want to check the temperature.
Temperature normal.
Okay. Any I want to check the tenderness.
Tenderness. Whenever before eliciting tenderness,
Okay.
do you ask to ask?
I want to ask that, do you have any pain over here, Mr. Harry? Please let
Yes,
me know.
doctor. Yes, doctor.
Oh, okay. Then I won't ask for tenderness. Okay.
No. Then you have to tell the examiner that I want to check for tenderness.
I
Patient is
want to
having
check
pain.
for patient is having pain.
Pain.
I want to check
Check
the
for tenderness. Should I proceed or not?
Should I proceed
Or not?
or not? Yes.
Then if the examiner tells proceed with gentle approach, then you will elicit the tenderness.
Okay.
I am training you proceed with gentle approach.
Okay. And I want to check for any gibbous.
Absent.
Okay. I want to check the movement of the spine.
Along which plane?
Which along the foreplane, forward, backward, lateral.
Okay. No restriction is there.
Okay. I want to I want to examine the lower limb of the patient.
What you want to check?
At first I want to look for the power, tone,
Normal.
reflex.
Normal.
Okay, then I want to check the sensation.
Normal. 2 minutes left, doctor.
Okay. Plantar.
Plantar is flexor.
Okay, I want to check the heart for any murmur.
Absent.
I want to check the lymph nodes.
Not palpable.
I want to check the base of the lung for any crepitations.
Absent.
Okay. So what is your concern, Mr. Harry?
Doctor, why I'm having this back pain?
So after talking to you and examining you, I have a possibility in my mind. You are suffering from this low back pain, possibly due to brucella infection. It is probably it has spread it from you as you have been visiting your cattle farm. So it can be a possibility that you have got this infection from there, and as you have been also drinking some milk, cattle milk, so it is from there the infection has spread it. It can be a possibility.
Doctor, is it curable?
Yes, with proper treatment, at first I need to admit you. Then with proper treatment, your condition is curable.
Okay, doctor. Thank you, doctor.
Okay, any other concern?
No, doctor. You have
So,
15 seconds left.
Yes, so what we are going to do now is we are going to admit you, and then we are going to form a multidisciplinary team, including infectious disease doctor, joint doctor, specialist nurse, who will help you and further assess you in this regard.
Okay, thank you. Time's up, doctor.
Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
I have differential diagnosis.
Yes, what are the differentials?
My first differential is brucellosis infection. Brucellosis.
Okay. Any other differentials?
It can be also tuberculosis.
Okay. Okay. So, what are the positive physical findings?
Yes. Positive physical findings are patient had low back pain for 10 days, and he has tender lumbar
Tenderness.
Tenderness.
Okay. Any other findings, doctor?
Sorry.
Any other positive findings? Anything else?
Um, um, uh,
You check the lymph node. Did you get it?
yes. No, lymph nodes were not present.
Okay. Okay. In the real exam, sometimes the examiner will just try to distract you by asking this question.
Okay.
So don't fall into the trap. This will be a purely dummy case. This case came at Pune Center. It was a dummy case with only positive family traveling history to the cattle farm. Now, doctor, how will you like to investigate?
Apart from basic investigation, I like to do MRI of the whole spine. Then ESR, CRP, the blood culture and sensitivity test.
Anything else? Okay.
A specific test for brucella.
What is the name of the test?
I could not.
Okay, you have to mention it. Brucella serology.
Brucella serology, yes.
Yeah. And first you have to do X-ray. Then you can proceed for MRI. And actually, we don't do MRI for brucellosis. So surely this will affect your mark in clinical judgment.
Okay, then only the brucella serology.
After doing X-ray of the lower back to find out the cause, we will do brucella serology. We can also do blood culture. Yeah, but blood culture, brucella usually all the time it is not found. We have to do a special culture for that. Now, tell me, doctor, how to manage.
At first, I will admit the patient, check for airway, breathing, circulation. Then I have to start antibiotic after consulting with the infectious disease
Doctor,
department.
tell professionally. Admission, airway, breathing, circulation. Anything else?
Then patient education and counseling.
Yes. Anything else?
Formation of multidisciplinary team.
Yes. If you don't mention it, mark will be lost in clinical judgment. This is very much simple, but simple things are missed most often that you have seen today.
Okay.
Then treatment.
Treatment of the underlying cause.
Yes. And pause for some time. Don't give all the answers in one go. Let the examiner ask you questions. You have mentioned treatment of the underlying cause. Then the examiner will ask you, suppose it is brucellosis. What will be your treatment? Now mention the answer.
I will consult with the infectious disease department.
Yes, this is the tricky answer. So that's all for this case, doctor. So, Dr. Preeti, are you there, doctor?
Yes.
So, let me help to provide judgment to Dr. Farida. You have to provide the judgment. So this is a case of low back pain with brucellosis. This would be written like this. Now, Dr. Preeti, what is your judgment for performance of Dr. Faria for physical examination skill?
I think important everything was done.
Okay. So can you divide the examinations again into CCCA? To confirm the diagnosis, what examinations we have to do and what Dr. Faria has done. Can you elaborate for others?
Okay, to confirm the diagnosis, examination of the back, she done.
She has done, yes. So it is done in the form of look, feel, and move. She has done it wonderfully. Now to find out the cause, what examination we should do?
Anemia. Is there any anemia or?
What is the underlying cause? Brucellosis. So is there any physical examination that can give you clue brucellosis? Do you know? Dr. Fariha?
You have told me the musty order, excessive
Yeah,
sweating.
it is from the history. This thing we are just discussing about physical examination. The thing is that in case of brucellosis, sometimes the patient can have splenomegaly in rare condition. So the patient would be purely dummy case, but we have to palpate the tummy looking for splenomegaly. Are you getting it, Dr. Fariha?
Yes.
Are you aware of the fact? Are you?
Yes, I forgot actually.
Yeah, that's why we have to think inside our mind in this CCCA. So tummy examination or abdomen examination palpation was not done. Then, Dr. Preeti, what will be the examination to look for the complications?
And is the dehydration was done or not?
Yeah, actually, my suggestion would be before starting for examination, always offer to check bedside vitals in the form of pulse, temperature, respiratory rate, oxygen saturation, sitting and standing blood pressure. If there is dehydration present, there will be drop in sitting, standing blood pressure. There will be postural drop there. So the evidence of dehydration is postural drop, because in the PACES exam, real dehydrated patient will never be given. Whenever you are checking the tongue, you will never find any dry tongue. It will never be given. They will ensure the utmost safety of the patient. And in the UK, actually, it is the job of the sister or nurse there to check the vitals. It is not our job. So we just have to offer to check bedside vitals. Just memorize this line. I want to check the bedside vitals in the form of pulse, temperature, respiratory rate, oxygen saturation, sitting and standing blood pressure, looking for postural drop. Sounds clear, Dr. Preeti?
Yes.
Dr. Fariha?
If they tell me that vitals are same as outside, then
good question. Then you have to mention the tricky answer that I have seen the vitals outside, but I want to know whether it is the same right now.
Okay.
This is the tricky answer. This question was asked, and the answer was this. So every time, offer to check the bedside vitals. If you find any abnormality here, then you can decide on admission. Like for pulmonary embolism, if there is no low saturation, then we don't have to, if the blood pressure is normal, then we actually don't have to admit the patient. So this has important implications. My suggestion is always start with offer to check bedside vitals in the form of pulse, temperature, respiratory rate, oxygen saturation, sitting and standing blood pressure. Then Dr. Preeti, what examinations we have to do for complications of this case?
Plantar and
yeah,
gait.
she has checked. Yes, Dr. Fariha did not check the gait. So gait examination and abdomen palpation. These two examinations were missed. There is no examinations for association. After completing this CCCA, you can check the anemia. You can check the tongue. But that will actually not count your mark. Are you getting it, Dr. Fariha?
Yes, yes.
So now tell me, Dr. Preeti, what will be your judgment? Will it be satisfactory? Will it be borderline? Or will it be unsatisfactory?
I think only missed examination is
abdomen and gait.
And gait.
Yes.
So it will be borderline.
Yes, doctor. It will be borderline. And during your mutual practice, you have to practice like this. Now tell me, what is the identifying physical signs? This was a dummy case. This would be a dummy case in the PACES exam. This case came at Pune Center, and this was purely dummy case. A young medical student was brought there. So only clue is tenderness. The patient will tell you that I feel pain whenever you are going to press my lower back. No other positive physical findings. Now tell me, doctor, what is your judgment for identifying physical signs?
Satisfactory.
Yes, it is. Now come to the clinical communication skills. What is your judgment for this? Did Dr. Faria analyze the lower back pain? Did Dr. Faria took all the components of PDF Sajid? And also,
Yes.
did Dr. Fari analyze the low back pain properly?
Yes.
Okay, let me. So Dr. Faria asked for, can I see the site to differentiate it from pyelonephritis? Did she ask the morning jamming? Did she analyze the pain using the mnemonic OD para? How did it started? Suddenly or gradually? Is it the first time? Is it gradually increasing day by day? Anything increase or decrease your symptom? Dr. Fariha, did you ask this question?
No, I only asked the liquor.
Liquor. Yeah. You asked the liquor, but you did not ask the odipara. And this is a must because you have to identify whether it is sudden onset or gradual onset, whether it is gradually worsening day by day, whether anything increase or decreases symptom. How can you be sure that it is a mechanical pain? You did not even ask for morning jamming. Are you getting it, Dr. Fariha?
Yes.
So these things were missed. And this will affect your mark in clinical communication skill because this forms the part of history take. Is it clear to you, Dr. Preeti?
Yes.
So now tell me what will be your judgment for clinical communication skill?
Then it will be borderline.
Yes, doctor. It would be borderline. But wonderfully, Dr. Fariha touched all the point of PDF Sajid and also the travel history. And during our introductory session, if you remember, I mentioned that only for cough, diarrhea, fever, and joint pain, for these 4 prompts, we have to take the history of pet, history of casual sexual contact, and travel history. This was the reason. Now, tell me, what is your judgment for differential diagnosis? There is only one differential diagnosis, brucellosis, and you can keep TB. Also, it is less likely only for 2 days onset of pain, but you can keep it. This is no harm. Now, tell me, Dr. Preeti, what is your judgment for differential diagnosis?
She mentioned brucellosis.
Yes.
So it is satisfactory.
Yes, it is satisfactory. Now come to the clinical judgment. Dr. Fariha did not mention the X-ray and did not mention the brucellosis serology. And during management, she did not mention the education and counseling, forming a multidisciplinary team, which is a vital and must to say for all the case of management. Because as working there as ST3 level, our main job will be to form the multidisciplinary team. They will assess us whether we are able to form this multidisciplinary team. And whatever management you say, what type of management for details, it will never give you full mark if you don't mention these 2 lines, education and counseling, forming a multidisciplinary team. This is very much simple, but candidate most often miss these things. So, Dr. Preeti, what is your judgment there?
Then it will be borderline.
Yeah, it will be borderline. In real exams, sometimes it will be unsatisfactory for some examiner. Then come to the managing patients' concerns. What is your judgment for that? There were 2 concerns, and Dr. Fariha wonderfully made them.
Yes, it's satisfactory.
Yes, it is. And welfare is satisfactory. Always say thank you to the patient. If possible, utter the word for 3 times and do the handshake. And help the patient to put on the gown. Whenever you are doing the help, the surrogate will come and take the job from your hand. And this will give a positive impression to both the examiners. Do that thing. Now, Dr. Preeti, please tell me what will be the total mark out of 40 from each of the examiners. For satisfactory, it is 2, and for borderline, it is 1. There are 4 satisfactory and 3 borderline. Now, please tell me the calculation.
11
Yes.
out of 14.
Yes, it is 11 out of 14 from each of the examiner. If we multiply it into 2, just thinking both the examiners are providing same judgment, then it would be 22 out of 28. Have you got it, Dr. Preeti?
Yes.
Dr. Fariha, do you have any questions?
Yes, no. No, don't have it.
So don't worry, doctor. This is the first session. You have to practice like this. I think you did not practice. And during practice, like Dr. Preeti, whenever you are practicing, all the informations are written here to act like a surrogate. You have to utter this line in front of Dr. Fariha during practice. And from today on, Dr. Fariha has to practice with Dr. Preeti using the course materials, and Dr. Preeti will have to practice with Dr. Fariha. One time, one will be examiner, another will be candidate, and this role will vice versa. And gradually, you will see this long clinical consultation will become very much easy to both of you if you proceed like this. Now it's turn of Dr. Preeti, and this time, Dr. Fariha has been appointed by RCP as the examiner. Is that okay with you, Dr. Preeti?
Yes.
Okay. Let me pick up a case for you. This is your case, Dr. Preeti. You have 2 minutes time, and Dr. Fariha, whenever Dr. Preeti will perform, please have a mindful ear to her performance. Are you able to see the screen, doctor?
Yes.
Okay. We have already got one champion of today's session. That is Dr. Farjana. For each session, whoever will get full mark, she will be the champion of that session.
May I start?
Yeah, you can start, doctor. Start.
Okay, hello, I'm Dr. Hosna, one of the doctor working in this clinic. Are you Mrs. Selima, 40 years old?
Yes, doctor. I'm Mrs. Selima. I'm 40 years old.
Okay, today we are going to talk about your health condition and at the same time I will examine you. Is that okay?
Okay, doctor.
Okay, I may take some notes during our conversation, but be sure everything remain confidential, okay?
Okay, doctor.
Okay, at first, may I know what problem brought you here today?
And doctor, I'm having some hand pain for the last 1 month. It's not only hand pain and leg pain. Both the hand and leg both are being so much painful, doctor. Please help me.
Okay, I'm really sorry for your suffering. Let us see how can we help you regarding this matter.
Okay, doctor.
How did it start? Suddenly or gradually?
It's started almost suddenly, doctor.
Okay, for how long are you having this symptom? You said 1 month, right?
Yeah, 1 month.
Okay. Is there any change in recent pattern of your pain?
No,
Or
doctor.
same?
It's getting worse. Yeah, the pattern is changing that it is getting worse, doctor.
Okay. Um, is it first time?
Yeah, this is the first time.
Okay. Anything make it worse?
Like whenever I go myself to the cold weather, I feel my pain gets worse. Even after not going to the cold weather, it becomes worse.
Okay. Anything improves your condition?
Like after warming my hand, or sometimes after doing without anything, it automatically improves.
Okay. Is there any uh, uh, associated feature you want to mention?
Like what?
Uh, like any joint pain?
No, doctor.
Okay. So exactly where do you feel the pain? May I know?
Doctor, at the tip of the fingers are painful. Also, the toes are very painful.
Okay, I'm sorry for that. How severe it is on the scale of 1 being minimum and 10 being maximum?
Doctor, whenever the pain comes, it is 7 out of 10.
I'm really sorry. I can give you some painkiller or when you feel pain. Right now, is it painful?
No, doctor. Right now, the pain is settled, but it can come anytime.
Okay. What sort of pain it is, like dull or
This is very much sharp pain.
okay? After starting this pain, it radiates and it goes any other part of your body?
No, doctor.
Like,
Only the
okay.
hands and legs are painful. Nothing else.
Okay. So, may I ask you do you have any long-term illness I should be aware of,
No, doctor.
like high blood pressure, high blood sugar?
No, doctor.
Okay. So, um, is there any color change of your finger or toes on exposure to the cold?
Yes, doctor. It is there.
Is it sequential from pale to blue to red, like that?
Yes, it is, doctor.
Okay. Is there any tingling and numbness sensation uh, at that area, which
No,
is
doctor.
taking?
It's very much painful actually.
Okay. Um, is there any morning jamming
No,
on that
doctor.
area?
There
Okay.
is no morning jamming, doctor.
Okay. So, do do you have any fever?
No, doctor. I don't have any fever.
Any weight change?
No, doctor. My weight is stable.
Okay. Any weather preference?
No, doctor.
Any lumps in any part of your body?
No, doctor. I didn't notice it.
Okay. Any headache?
No, doctor.
Visual problem?
No, doctor.
Okay. Do you have any chest pain?
No, doctor.
Racing pacing of your heart?
No, doctor.
Any cough?
No, doctor.
Shortness of breath?
No, doctor.
Okay. Any tummy pain?
No, doctor.
Mouth sore?
No, doctor.
Any changes in your water work in amount, color, or frequency?
No, doctor.
Okay. Uh, Any color change of your face when exposed to sunlight?
No, doctor.
Okay. Any changes, any neck swelling? Have you noticed?
No, doctor.
Okay. So, do you have any past medical condition? You mentioned, but
Yeah.
any previous surgery,
No, doctor.
any hospitalization before?
No, doctor.
Okay. Any contact with any sick patient?
No, doctor.
Okay. May I know about your medication list?
I don't take any regular medication, doctor.
Okay. Do you have any allergy to any medication?
No, doctor.
I'm sorry to ask, do you take any party medication?
No, doctor.
Any history of taking any over-the-counter medication?
No, doctor.
Okay. Any condition running in your family?
Not significant, doctor.
Okay. Anyone of your family having the similar condition?
No, doctor. Only I have the problem.
Okay. Do you smoke?
Yes, doctor. I smoke
How many sticks for how long?
about 30 cigarettes per day for last 25 years.
Okay. And you know any amount of smoking is injurious for health. You should stop smoking. I can help you by referring you to smoking cessation clinic. Is that okay?
Okay, doctor.
Do you drink alcohol?
Yes, doctor. I drink sometimes at the weekend.
Okay. Is it in social limit?
Yes, doctor. It is within social limit.
Okay. What do you do for living?
I work as a corporate officer, doctor.
Okay. Is the condition affecting your job and daily activities?
Yes, doctor. It is affecting a lot. For this pain, I am not able to attend my job, and also I am not able to do my daily activities.
Okay, don't worry. I'm going to refer you to the occupational health worker and social health worker. They can help you regarding this matter. Okay.
Okay, doctor.
Do you drive?
No, yes, doctor. I drive my own car, but right now I'm not able to drive, doctor, due to this pain.
Okay, we will refer you to the DVLA. They can help you regarding this matter.
Okay, doctor.
Okay. I want to examine the patient.
Okay, what do you want to examine?
I want to at first examine the upper limb.
Okay, what do you want to see?
I want to look, is there any finger ischemic change or any
There are multiple amputated fingers.
Okay. And is there any ulceration?
Yeah,
And
there is ulceration patient, blackish ulceration patient at the tip of the amputated fingers.
okay. And is there any gangrene?
Yeah,
Blackish lesion?
blackish present.
Okay. I want to check the pulses.
Okay.
Pulse, bilateral,
Normal,
brachial pulse, bilateral,
normal.
and also want to check carotid.
Okay,
And
normal.
also want to check the pulses of the lower limb, arteria dorsalis pedis.
Normal. Before palpating the lower limb, do you want to check anything else?
Yes. Is there a raised temperature?
If anything else you want to look?
Yes. Yes. I want to look. Is there any ulcer?
There are
Ischemic.
also multiple amputated fingers at the lower limb.
Yes. And gangrene also. Yes. Then want to check the pulses, arteria dorsalis pedis,
Normal.
posterior and popliteal and femoral also bilaterally. And
Normal, doctor. 2
want to
minutes
check
left.
bruit. Is there any carotid, subclavian, renal, femoral bruit?
Absent.
Okay. So I want to also check the functional capacity of the hand. Can you please lift your hand and
Yeah.
buttoning and loosening?
It is difficult.
Okay. Okay. So may I know what's your concern?
Doctor, why I'm having this hand pain and leg pain?
Okay. As I have talked to you and examined you, you have a condition. In our medical term, it is called Barger's disease. Don't bother with the medical term. It is a condition in which the soreness of the blood vessel occur in the body That's why this type of pain occur due to lack of proper blood supply. Okay,
Doctor, so doctor, is it curable?
um, actually, it's not completely curable, but we can manage. And also, I will talk to my senior about this to take proper decision. Okay.
Okay, doctor. Do I need any admission right now?
Yes, we going, as you have a severe pain, and we going to admit you and form a multidisciplinary team. Also, we will give a referral to the vascular surgeon regarding this matter to give you proper support and management. Okay.
Okay, doctor. Thank you.
Do you have any other concern?
No, doctor. Time is up. So, doctor, do you have any diagnosis or differential diagnosis?
I have differential diagnosis. It could be Barger's. It's Barger disease, and my second differential is peripheral vascular disease. Though
Okay.
patient um, age is 40 years, so it's my second.
Okay. So, what are the positive physical findings?
Okay, in physical finding, there is some multiple digital ischemia and some gangrene and ulceration, and also amputation of some fingers and toes. And in history, there is a patient is smoker, long-term smoker, and
Okay. Actually, there you have to mention the positive physical findings, not from the
okay,
history.
okay.
So, doctor, how to investigate?
Apart from the basic investigation to confirm our diagnosis, I want to do ESR, CRP, and also CT angiography or magnetic resonance angiography.
CT angiography. Okay. So, doctor, how to manage?
Okay. Patient, I will do patient education and counseling, then form the multidisciplinary team and treatment of the underlying cause. For the Barger disease, I will first advise for smoking cessation to control pain, a paracetamol or NSAID. If severe pains, I will suggest stronger analgesic, and also um, intravenous iloprost, if not controlled, calcium channel blocker, amlodipine or nifedipine.
Okay. So, doctor, what do you expect in angiography for Buerger's disease?
Sorry, I could not hear.
In the investigation, you have mentioned CT angiography, right?
Yes.
So, what do you expect to get there for Buerger's disease?
Is there any small vessel, medium vessel changes?
Actually, Dr. Buerger's disease is a clinical diagnosis. We just have to do the basic investigations. CT angiography is not necessary here. We don't go for angiography for diagnosis of Buerger's disease.
Okay, but for
Yes.
okay.
But for
Peripheral vascular disease was my second differential.
yes, that's why you have to mention that.
So I want to exclude.
Yes, that will be the correct answer. Whenever you are mentioning the CT angiography, examiner will understand that you are doing the investigations for Buerger's disease. So you have to be clear that to rule out the peripheral vascular disease, we can go for CT angiography. Though the patient is not having any risk factor like high diabetes, only apart from smoking. Are you getting my point, doctor?
Yes.
So whenever you are mentioning CT angiography, please mention it clearly in front of the examiner. Make it clear that you are telling it to rule out the peripheral vascular disease, not for Buerger's disease. Otherwise, he will count it as investigations of Buerger's disease. Are we getting it, doctor?
Yes.
Okay. So that's all for this case. So, doctor, why you admitted the patient? what is the criteria of admission for this patient? Is it necessary?
No.
So that was the wrong answer, doctor. We don't have to admit the patient because this is not a medical emergency and they don't like unnecessary admission. If you have any confusion, what can you tell? Can you tell it, doctor?
Yes,
Yeah.
I will
please.
keep you under our observation room. Then I will talk to my seniors and then run some tests according to.
Yeah, in the meantime, he will come and see you, and then I will be in a better condition to say whether you need any long-term admission or not. Keep you back at the safe side, but don't admit this patient, doctor. It is not like our local practice. Is it clear to you, doctor?
Yes, yes.
Okay. So, Dr. Fariha, are you there, doctor?
Yes. Sorry, I could not listen the first few minutes because there was a trouble with my internet.
Okay, that will be considered in clinical communication skill. But I hope you noticed the physical examinations.
Yes.
So the prompt was hand pain. These cases come at Pondicherry Center in Diet 1. There was no connective tissue evidence, only smoking history. And the lady was having multiple amputated fingers at upper, at hand and feet. So regarding physical examinations, Dr. Faria, what is your judgment for performance of Dr. Preeti?
Yes, satisfactory?
Yes, it is satisfactory.
Yes.
Only we have to identify the amputated fingers and we have to examine the pulse. Nothing else examination is needed there. Then identifying physical signs, Dr. Preeti identified all the positive signs there.
Yes, satisfactory.
Yes. Now come to the clinical communication skill. Did you notice her performance?
Yes, from the middle, and I could not hear the first.
Okay. Let me go back to the approach of hand pain for Raynaud's phenomenon. So, Dr. Preeti, did you ask this question of superficial thrombophlebitis, which is found in case of Buerger's disease? That have you ever noticed a painful red tender line or lump under the skin, especially arms or legs? Does it disappear? Does it appear at one place, settle down, and then come back in another place?
I missed the questions.
Yeah, you missed this point. Another thing is that I'm just adding it, Dr. Fariha, as you have mentioned, you did notice the performance. Did you take the female history, doctor? Dr. Preeti?
No, I missed.
Yeah, you missed the female history. Partner pill period pregnancy, abortion. This history was completely missed. This thing has nothing to do with the real diagnosis, but this is a part of history taking for female with reproductive age. Dr. Fariha, are you clear about this?
Yes.
So this 5P history was missed. This is surely going to affect your mark in clinical communication skill. Also, if you could ask the question of superficial thrombophlebitis, that would be better. Although no mark will be cut for that, but by asking this question, you can impress the examiner. So now tell me, Dr. Preeti, Dr. Fariha, what will be your judgment for clinical communication skill?
Then will it be borderline in that case?
Yes, it would be borderline. Now come to the differential diagnosis. Dr. Preeti mentioned 2 differential diagnoses, which is justified.
Yes, then satisfactory.
Yes, it is satisfactory. And clinical judgment?
Satisfactory. She mentioned.
She admitted the patient.
Oh, okay.
Her vitals are normal. Why will admit the patient? What kind of medication will provide her? She is not having any low blood pressure, no low oxygen saturation. So we can just give her advice to stop the smoking and give some calcium channel blocker and arrange some follow-up. We can arrange a referral to the vascular surgeon, but we don't have to admit that patient. So unnecessary admission was there. It will be written like this in the Ignore. It will be like unnecessary admission. This will be written like this. Now tell me, Dr. Pariha, what will be the judgment?
Then it would it cause to be borderline?
Yes, doctor. It would be borderline. Now come to the consent management. What is your judgment for consent management?
She managed the concerns. I
Yes.
think satisfactory.
Yeah, it is satisfactory. And we are considering welfare satisfactory for all the candidates because it is not possible to judge it over online. So now let me, please tell me, Dr. Fariha, what will be the total mark out of 14 from each of the examiner? For satisfactory, it is 2. For borderline, it is 1. Count yourself, please.
12.
Yes, it will be 12. So it will be exactly written like this. It will be 12 out of 14 from each of the examiner. If we guess that both the examiners are giving the same mark, then we can just multiply it into 2. So it will be 24 out of 28, which is actually a good mark for starting. Very good mark. And gradually you will see the difference. I think Dr. Preeti has not practiced. Did you practice, Dr. Preeti?
Not properly.
Yeah. It will be easily understandable by seeing your voice. So don't worry, doctor. I hope you understood how to practice. So from now on, Dr. Fariha has to practice with Dr. Preeti after taking preparation. Like our next practice session will be on neurology part 1. First, you have to make notes for neurology part 1 prom session. It is uploaded at the YouTube and all that. Already you have got the prom session. Then you have to go through each of the cases separately from this neurology case sheet. Your homework will be from case number 1 to case number 35. And after taking the preparation for each of the cases separately, make your notes here in this blank page. For the physical examinations, investigations, and management, take help from the video recording. Then you have to practice mutually with each other. Dr. Preeti and Dr. Fariha, are you giving me the word to do practice, doctor?
Yes.
Yes.
So Dr. Preeti, please do this. And Dr. Fariha, also do this. You are going to act like a partner now. See you in the next practice session. Now, do anyone have any question from this scenario?
Doctor,
Yes, doctor.
in Berger disease, what is about the pulse? Will be reduced or normal?
It can be reduced or it may not be reduced. Both can be present.
Okay.
It comes and goes episodic, but there will be Raynaud's phenomenon. These cases come for the first time at Pondicherry. It did not come anytime earlier. In this year, Diet 1, it has come in the Pondicherry Center.
Okay, thank you, doctor.
Most welcome, doctor.
Hello,
Any
sir.
other?
Hello, I
Yes,
have a
doctor.
question.
Sure,
Yes.
doctor.
Yes, sir. Can we consider Raynaud as the diagnosis?
Yes, doctor. Hand pain due to Raynaud's. And the
So-
cause of Raynaud's is Barger's disease. If
Okay,
you
and-
mention, yes, doctor.
And if she's suspecting Raynaud, shouldn't she be examining the face as well? If she's suspecting local scleroderma.
Yeah, actually, just by looking at the patient, you can guess your diagnosis. And in the history taking part, she asked this question. There are some certain questions to screen the rheumatological disease, connective tissue disease, that do you have any skin tightening, any joint pain, any facial rash after going to the sun, any mouth sore. She asked it previously. And systemic sclerosis patient can be diagnosed easily just by looking at the patient.
Okay, sir.
So you have to decide it just by looking at the patient and taking history. And wonderfully, Dr. Preeti ruled out the connective tissue disease from the history.
Okay, sir.
So, sir, if the patient has amputation, still we have to ask the connective tissue disease and also the smoking related questions and the
Yes,
Barger
doctor, of
disease
course.
related question, both of
Yes,
this.
doctor.
Yeah.
Yes, doctor. because there are two differential diagnoses of Raynaud's phenomenon.
Yes, sir.
Yeah, yeah. Anytime in the PACES exam, the Raynaud's phenomenons come, either it would be connective tissue disease or it would be Bullous disease. So you have to rule out by asking the screening question. To rule out the Bullous disease, the question is, do you smoke? And to rule out the connective tissue disease, you have to ask any joint pain, skin rash, mouth sore, any skin tightening. Is it clear, Dr. Shama?
Yes, doctor. Then by history, we can rule out this, but during examination, shouldn't we perform the examination which is related to this question, like eyes examination or checking the mouth sore? These are not important.
You can do this. Even if you miss this, because you ruled it out from the history taking. Even if you miss this, it is okay. Because already you have ruled it out from the history taking.
Okay. But we should give emphasis on the budget disease. I mean, the pulses, because the amputation.
Yes, doctor.
Okay, thank you, sir.
So anytime in the PACES exam, after entering, you are seeing multiple amputated fingers and hands and feet, and the patient is complaining of hand pain due to Raynaud's. You can guess your diagnosis of Bullous disease. I hope this is clear to all. Up to now, no other cases has come for hand pain, apart from these 5 causes that I discussed in musculoskeletal problem session. So let me proceed to the next pair of candidates.
Sir, can
yes,
you please repeat the 5 P's in the history?
5P means, female history, doctor. It was discussed in the introductory session. It was given to all the registered candidates with a PDF. 5P means female history: partner, pill, period, pregnancy, abortion.
Okay.
This has to be taken for all reproductive age female. And if the female is more than 50 years, like postmenopausal, you have to ask, are you done with your period?
Okay, sir. Okay, sir. Perfect. I have taken a screenshot. Thank you.
LCC actually is very much simple if you once understand the pattern. It's not that much difficult. So let me proceed to the next webcam. So Dr. Anika Hussain, are you there, doctor?
Yes.
And Dr. Nilofar, are you there? Dr. Nilofar, can you hear me? Dr. Nilofar? Okay. Dr. Shananda, are you there, doctor? I'm seeing you are there.
Yes, I'm here.
Okay. So right now, Dr. Anika Hussain will be the performer and Dr. Shananda will be the examiner. So let me pick up a case for Dr. Anika. So this is your case, Dr. Anika. Are you able to see the screen?
Yes.
Okay.
Bhaiya, can I start?
Yeah, you can start, doctor. Start.
Hello.
Doctor, just take 1 minute. Dr. Shananda, please be mindful about Dr. Anika's performance because you have to provide the judgment. Yeah, start,
Yes,
doctor.
sir. Okay.
Start.
Hello, good afternoon. I'm Dr. Hossan, one of the doctors working in this clinic. Can I confirm your name and age, please?
Doctor, I'm Mr. Jackson. I'm 30 years old.
Okay, nice to meet you, Mr. Jackson. Today we are going to talk about your health condition. At the same time, I will examine you. Is that okay?
Okay, doctor.
Okay. During our conversations, I may take some notes and be sure that it will be confidential. Is that okay?
Okay, doctor.
Okay. Can you please tell me what problem brought you today here today?
Doctor, I'm having some low back pain for the last 3 months. I think it is getting worse day by day. Please help me, doctor.
I'm really sorry for your suffering, Mr. Jackson. Can you tell me how did it started? It is suddenly or gradually started?
Doctor, it started gradually.
Gradually. I'm sorry for that. No, is it for the first time or you have some symptoms you have before?
No, doctor, this is the first time.
Okay. Any symptom, any conditions that increase your symptoms, like any movement, any medications?
No, doctor, I have seen that whenever I take rest for a long period of time, my pain gets worse. And movement actually improves my symptoms.
Okay. Any conditions that improves your conditions?
Like after doing some movement, I feel better.
Okay. Can you please tell me where is the exactly pain?
Okay, patient is showing the end of the lumbar spine.
End of lumbar spine. Okay. Now, if I mention the 1 is minimum and 10 is maximum, how can you rate this pain?
Doctor, sometimes whenever I get up from the bed, the pain is so severe that it is 7 out of 10.
7 of 10. Do you need any painkiller medications right now?
That will be helpful, doctor.
Okay, thank you. Then I can give you some painkiller medications for your pain. Can you please tell me if you start from here, does it goes anywhere?
No, doctor.
Okay. And any weakness in any part of your body?
No, doctor.
Do you have any change of sensations in your private part?
No, doctor.
Any loss of your motion or urine output?
No, doctor.
Okay. Does it this pain awake you from your night?
Yes, doctor. Sometimes I have to wake up at night due to this back pain.
Okay, I'm really sorry for that. And does any change of any sensation in your both legs?
No, doctor.
Okay, so now can you please tell me, do you have any um, changes of your color during exposure to cold?
No, doctor.
Okay, did you have any redness of your eyes or painful eye?
No, doctor.
Okay, now do you have any hair loss?
No, doctor.
Any gritty sensation or in around the eye and mouth?
No, doctor.
Any tummy pain?
No, doctor.
Any chest pain or shortness of breath or cough?
No, doctor. Ask one by one question, doctor, not
Okay.
multiple.
Okay. What about your urine output?
It's okay, doctor.
Okay. Now, so I'm any past medical history that I should be aware of?
No, doctor. Nothing
Okay.
significant.
Any do you have any history of hospitalization before?
No, doctor.
Any history of blood transfusion?
No, doctor.
Any history of tattooing or piercing recently?
No, doctor.
Any history of injury?
No, doctor.
Any history of contact with any sick patient?
No, doctor.
Any do you have any disease that I should be aware of, like any high blood sugar,
No, doctor.
high blood pressure,
No, doctor.
high blood cholesterol?
No, doctor.
Do you take any medications?
No, doctor. I just sometimes take paracetamol. Nothing
Okay.
else.
Okay. Did you recently started any medication?
No, doctor.
Any stopped any medication?
No, doctor.
Do you have any over-the-counter medication?
No, doctor.
And I'm sorry to ask, do you have take any party medication?
No, doctor.
Any herbal medication?
No, doctor.
Do you have any allergy to any medication?
No, doctor.
Okay. So no. Any family history that I should be aware of?
My brother used to have a bowel problem called Crohn's disease, doctor.
But no, I'm sorry for your brother and for these conditions. Did any doctor mention about his diagnosis?
Yeah, it was Crohn's disease.
Crohn's disease. Okay. Now he is doing well.
Yeah,
Okay.
he's doing well, doctor, with
Okay.
the medication.
Okay. Do you have any uh, pet in your home?
No, doctor.
Do you have any long-term partner?
Yes, doctor. I have my wife.
Okay. Are you guys doing well?
Yeah, doctor.
Okay. Do you have any recent traveling history?
No, doctor.
Okay. I'm sorry to. I'm going to some personal question. Do you smoke?
Yes, doctor. I smoke
How many sticks for how long?
about 10 sticks per day for the last 10 years.
Okay, as you know, Mr. Jackson, smoking is a very injurious to health. So we have to stop your smoking. So we can refer you to our smoking cessation clinic for further management. Is that okay?
Okay, doctor.
Do you drink alcohol?
I drink sometimes at the weekend.
Okay, is it within social limit?
Yes, it is, doctor.
Okay. So what do you do for your living?
Doctor, I work at a corporate office.
Corporate office. Does these conditions affecting your job?
Yes, doctor. Actually, I have to sit for a long period of time, but I have noticed that sitting actually increases my symptoms.
Okay, as this job is affecting your condition, so you can change your job. So for that, we can refer you to our social occupational healthcare worker, and we will write a report regarding your disease, so that you can okay, you can leave some sick leave. Is that okay?
Okay, doctor. Just mention for this, I am going to refer you to the occupational health department.
Okay, okay. And uh, do you have morning jamming?
Yes, doctor. I have that.
For how long?
It's more than 40 minutes, doctor.
More than 40 minutes. Do you have pain in other part of your body?
No, doctor.
Okay. Can I examine you?
Sure, doctor.
At first, I want to do you have I want to exposure of the area of your pain.
Okay. Lower back
Do
is exposed.
okay. Now, do you have pain?
No, doctor. I don't have any pain there. Whenever I just take rest, I feel pain.
Okay. So now, can you do side to side movement?
Yeah, restricted.
Some forward and backward movement.
It is also restricted.
Movement restricted. Okay. And can you stand up for me?
Yeah. He has
And
stood up. What do you want to check?
I want to check the neck movements and
Okay.
side
Along
to
which
side.
plane? Restricted?
All side restricted.
Yeah. Along which plane? How many planes you want to check the movement?
Six planes.
Yeah, 6 planes. Forward, backward, side to side.
Side. And can you touch your ear with your shoulder?
Yeah. All are restricted.
Restricted. Okay. And can you please stand up for me and stand with your wall, and I can measure your occiput wall test.
It is increased.
It is increased. Okay. And can I measure the heel to wall test?
It is also increased.
Okay. And can I want to check the whole skin survey, including the private part, to see any rash.
Okay, noted, doctor.
Okay. Can you? I want to check the anemia of this patient.
Absent.
And check the redness of the eye.
Absent.
Okay.
2 minutes left, doctor.
Okay. No, check. I want to auscultate of the lung.
Which area?
In the upper zone.
No cavitations are there.
Okay. I want to check the movement of the chest.
How to check it?
To check the chest movement. Can you
Placing your hands.
Breathe in and out for me.
There is a restriction of chest movement.
Restriction of chest movements. Okay.
Yeah.
And I want to check the tenderness over the heel.
No tenderness is present.
Okay, and I want to I want to take the pulse.
Okay, what you want to check in the pulse?
Take the is it high volume?
No, absent.
Okay, and I want to auscultate the I want to see the patients and auscultate the lung for any diastolic murmur in the pneumatic area.
Okay, aortic area, left for intercostal space.
Left foot.
No diastolic murmur is present.
Okay, I want to complete my examinations by doing a urine dipstick test.
Okay, noted.
Okay, so but I want to check the gait of these patients. Can you walk for
Yes.
me?
Yeah, whenever he's walking, you'll see he is having stoop posture.
It's to postures. Okay. Thank you. Thank you for your time and cooperations. Where's the concern?
Doctor, why I am having this back pain?
Okay, as I have talked with you and examined you, I think you have a conditions, which we called ankylosing spondylitis.
What is it, doctor?
Okay, don't bother with the medical term. It's a conditions where your defensive system is attack your own healthy tissue. In your case, involve the joints and tissue of your back, and that's why you have some back pain and some movement problem. Are you getting me?
Yes, doctor. Doctor, is it curable?
Um, mm, I highly appreciate your answer, Mr. Jackson, but I'm sorry to tell you that it's not a curable conditions. But if you take your medications and good follow-up, we can it can be controlled. Is that okay?
Okay, doctor. Thank you.
Okay.
Time is up.
Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
My diagnosis is ankylosing spondylitis. Differential diagnosis is ankylosing spondylitis, and my differential is psoriatic arthritis.
Okay. Anything else?
Uh, uh, Enteropathic arthritis.
Okay, what is called? Enter.
Yes.
Yeah, anything else?
Or reactive arthritis, I couldn't appreciate, as though a patient have no discharge.
Yes. Did you ask for it?
No.
And did you ask for the loose motion and blood in the motion to rule out
No.
So you have to ask for this, doctor.
Okay.
And also, whenever you are mentioning the differential diagnosis like psoriatic arthritis, you have to mention that from history and physical examination, I could not get any evidence of psoriasis.
Okay.
So your primary diagnosis will be ankylosing spondylitis, and all the other three seronegative spondyloarthritis, you can mention it as the DD. This is a very much common case in the PACES exam. This case has come multiple times. Now tell me the positive physical findings.
As I examine the patients, she has some movement restricted in the lumbar region and neck movement, and modified Schubert test is positive.
Have you done it? Modified Schubert test?
I offered.
No, you did not offer it.
Okay. I had a mistake.
Yeah. And in the real exam, you have to do the modified Schubert test.
Okay.
This was my case. I had to do the modified Schubert test in front of the examiner.
And there is a restrictions of tenderness over the heel, and gait was stooped in posture.
Doctor, there was no tenderness there over the heel.
Tenderness. Okay.
Okay, suppose
Yes.
I understand that you have got me wrong.
Okay.
Okay, there is no tenderness.
Okay.
Usually there is no tenderness present in
Okay.
the PACES exam.
Okay.
But you have to check for brace for Achilles tendinitis. Okay. Anything else?
Okay.
You made the patient stand against the wall. What did you got?
Occiput wall test and test was increased, and
Yeah.
heel to wall test was increased.
Yeah.
Okay. I mean heel to test was increased.
What? Okay. Then, doctor, how to investigate?
Apart from basic investigations, I will do ESR, CRP, HLA B27 to confirm my diagnosis.
Anything else?
And at first, initially, I will do the X-ray of the sacroiliac joint and lumbar to see the and X-ray of the sacroiliac joint to see the sacroiliitis and fusion
Anything
of the
else?
joints.
Which fusion?
And fusion of the sacroiliac joint.
Okay. Anything else?
Mm, mm, if X-ray is normal, then I can do further MRI of the back.
Why not X-ray of the lumbar spine?
X-ray, I mentioned X-ray of the lumbar.
No, doctor, you mentioned X-ray of the sacral leg joint. If you mention that X-ray of the lower back, including the sacral leg joint and lumbar spine, that would be okay.
Okay.
Doctor. Okay. So, doctor, MRI, we can do it to look for bone marrow edema.
Bone marrow.
Yeah, but the primary investigations is X-ray
X-ray.
before HLA-20, B27.
Okay.
Now, how to manage?
At first, now we will educate the patients and counseling about the disease. Then we will form a multidisciplinary team, including a joint doctor, a specialized nurse, occupational healthcare worker, so they can give you proper care and management. And we will treat the underlying cause of the.
Okay. Suppose the underlying cause is ankylosing spondylitis. What would be your treatment?
At first, I will give some painkiller in the form of NSAID.
Okay.
And
Suppose the patient is not responding to any sign, then what will you approach?
can give DMRD or biologics.
What one will you choose? DMRT or biologics?
Biologics.
Why not DMRT?
If I found any peripheral joint involvement, then I will
Yes.
go for DMRD.
Yes, doctor. And doctor, did you take the casual contact history?
No.
Do you think it is important?
Yes, for psoriatic reactive arthritis, it is important.
Yeah. What is the organism that can cause reactive arthritis for casual contact?
Chlamydia.
Yes.
Chlamydia.
Chlamydia. This was the question I was asked by the examiner. So that's all. So let's start your judgment. So Dr. Shananda, are you there, doctor?
Yes, I'm here.
So this is a case of low back pain. The diagnosis is ankylosing spondylitis. So regarding physical examination, please provide your judgment for Dr. Anika. What is your judgment, doctor?
The only thing she missed that I noticed was modified Schober test, I think.
Yeah, this is the must to do. At least you have to offer it. For some center, they don't, they just say that no need to do. But some centers will allow you to do. I was allowed to do. So it is a must to do examination. Anything else?
I didn't
Did she
notice
check the
anything.
plantar?
Oh, no, she didn't check the plantar.
Yeah, she did not check the plantar. Have you got the examination sequences of ankylosing spondylitis or all the seronegative spondyloarthritis?
Yeah.
Let me show it again. Yeah, this is the examination sequence. To confirm the diagnosis, we have to check the lumbar movement, which Dr. Anika has done. Dr. Anika has checked the neck movement. Then she has checked for kyphosis. It was evident whenever she is making the patient walk. Then she has measured the occiput to wall distance, but she did not offer the modified Schober test. Then to find out the cause, she has offered to look for a whole skin survey, looking for psoriatic rash. Then we can check inside the mouth, looking for any mouth sore or a Crohn's disease, and offer to do pararectal examination to look for perianal tag, which can be found in case of Crohn's disease. He is also having positive family history of Crohn's disease, so we can offer for that. Then at the eye, we have to look for eye redness and rash at the sole that can be found in case of reactive arthritis. That is urethritis, then uveitis, and sarcinate balanitis. We have to offer to check the private parts looking for sarcinate balanitis. Dr. Anika wonderfully looked for that. Then we have to look for the complications. The mnemonic is 6A. That is anterior uveitis, apical fibrosis, ankylosis of the costochondral and costovertebral joint. Then aortic regurgitation, amyloidosis, and Achilles tendonitis. How to rule them out? It is mentioned in this PDF. So actually, this case was a little bit tough, Dr. Anika, and considering the first time, you have done very good. So, Dr. Shananda, what is your judgment now for physical examinations?
Borderline.
Yeah, it would be borderline only for not doing the modified Shower test. And there will be some interpretation for that. It will be reduced. Like it will be positive. Now tell me the identifying physical signs. Dr. Anika checked all the things. Only for not doing this examination, she missed the positive sign.
Right.
So sorry
So
to say, this
borderline.
will again affect the mark in identifying physical signs. Are you getting it, Dr. Anika?
Yes, ma'am.
So, Dr. Shananda, what is the judgment then in identifying physical signs?
I think again borderline.
Yes, doctor. So, have you seen how one skill is linked to another? Like
Yeah.
only for not doing this important examination, marks are cut in physical examination, also in identifying physical signs. And you'll understand once you will try to provide mark to other candidate using the mark sheet. You'll understand the complexity. Like it is not complex, it is very much beautiful. You will understand the pattern of long clinical consultation. Once you will practice providing mark like this, you have to practice this with each other frequently. That is the reason I requested you every day. For the active candidates, every day I poke them whenever I get time to do some mutual practice. This was the reason. Don't worry, it will be okay. Then come to the clinical communication skill. Dr. Shananda, what is your judgment for that?
She missed the screening questions for the other inflammatory conditions.
Yeah, screening question. Like, can you mention the screening questions to rule out other inflammatory low back pain?
Whether there's any skin rash for psoriatic arthritis, whether there's any discharge from the private parts for reactive arthritis.
Yes.
Any loose motion, any blood in stool for inflammatory bowel disease.
Yes, good. Then, any other judgment for clinical communication skill?
She missed about the casual contact history.
Yes, doctor. She missed the casual contact history. And this is a must. I was asked this question. Why did you take the casual contact? The British doctor asked me. Anything else? Did she ask the driving?
No.
So it is a part of history taking. I had mentioned PDF Sajid. Any part of the PDF Sajid, if you miss it, mark will be cut for sure. Are you getting it, Dr. Anika?
Yes.
Don't worry, doctor. This is one of the toughest case of this session. So don't hesitate because there are lots of examinations to do. The way we have performed it is good. So now tell me, Dr. Shananda, what is your judgment?
Borderline.
Yeah, it would be at least borderline. Then come to the differential diagnosis. What will be your judgment? Dr. Anika has mentioned all the 4DD.
I think satisfactory.
Yes, satisfactory. And also, Dr. Anika, whenever you are going to mention other DD, tell the points against them. Make it clear to the examiner. Now come to the clinical judgment. What is your judgment for that?
Satisfactory.
Yeah, satisfactory. Only mistake was that you didn't mention the X-ray of lower back. So it is negligible. Please remember this thing. You can just mention X-ray of lower back, including the sacroiliac joint and lumbar spine. So what do you expect, Dr. Anika, in lumbar X-ray? Can you mention? Dr. Anika?
Fusion of the joint or bamboo spine.
Yes, doctor. Fusion of the joint or bamboo spine. That's good. Now come to the consent management. What is your judgment for that, Dr. Shananda?
Satisfactory.
Yes, it is satisfactory. Now welfare management.
You said that we can't judge that online.
Yeah, so we have to provide it satisfactory for all. Now tell me what will be the total mark out of 14 from each of the examiner. For satisfactory, it is 2. For borderline, it is 1.
11.
Yes, 11. If we multiply it into 2, it is 22 out of 28. Don't worry, it's just a beginning. You'll understand your performance once you start progressing. Dr. Anika, do you have any question from this scenario?
No.
Okay. Dr. Shananda, do you have any question?
No.
Okay. Any other candidate having any question from this scenario? Okay.
Sir, I have a question, sir.
Sure, Dr. Shabab.
As part of history, should we take some systemic review here regarding gastrointestinal and also because there are some complication aortic regurgitation? Can we ask racing pacing of heart?
Yes, doctor.
And also the respiratory quality, because ankylosing spondylitis can fibrosis. So
yes.
any
So
cough
what question?
or
yes, doctor. Breathlessness and cough. Good question. You can ask this question.
Okay, thank you.
So in this way, you have to identify the triple CA. Right now, you have pointed the right thing, that to find out the complications, what question you can ask. The more focused you will become, it will impress the examiner. Like if you ask, did you have any episodes of eye redness, looking for uveitis? Do you have any cough, shortness of breath, to rule out apical fibrosis, or any aortic regurgitation, any racing pacing of heart, to rule out the ankylosis of the costovertebral joint, any, this is for breathlessness. Then to rule out the amyloidosis, just ask any frothiness of the urine. Because in amyloidosis, patient can have nephrotic
syndrome. Yes, sir.
Then also you can ask, do you have any pain at the back of your heel?
Okay.
So
yes,
that's why you have to prepare beforehand, before going to the exam. In this course, I don't provide blind cases. And these are the real cases. It will come exactly like this in the PACES exam. Thank you, Dr. Shabab. You have got to the point.
Thank you, sir.
So, Dr. Shananda, it's now your turn, but next turn you just have to practice. Like you can use these case details to practice. I hope you understand. Now it's turn of Dr. Shananda, and Dr. Anika will be the examiner. Are you there, Dr. Anika?
Yes.
Okay, so let me pick up a case for Dr. Shananda. So this is your case, Dr. Shananda. You have 2 minutes time to take preparation.
Okay.
Dr. Shananda, are you ready, doctor?
Yes.
Okay. Your time starts now. Dr. Anika, please look at the performance of Dr. Shananda because you have to provide the judgment.
Okay.
Now start.
Hello, I'm Dr. Shananda. I'm one of the doctors working here. Can I confirm your name and age?
Yes, doctor. I'm Mr. Watson. I'm 65 years old.
Okay. So I'm here to talk to you today about your problem and examine you. Is that all right?
All right, doctor.
Okay. I might take a few notes during our conversation, but everything will be confidential here. So I hope that's
doctor.
okay. So can you tell me what brings you to the hospital today?
Doctor, I'm having some knee pain for the last 2 days, doctor. It started suddenly and I think it is getting worse day by day. I think I really need some help from your side. Please help me, doctor.
Okay, I'm really sorry to hear about that. I'll try my best to help you. So you said it started suddenly.
Yeah.
How long ago did it start?
Sorry?
How long have you been having the pain?
For last 2 days, doctor.
Days, okay. And is this the first time?
Yes, doctor. Actually, not the first time. This severe pain is the first time, but earlier I used to have some pain of my knee joints. I was having some wearing and tear of my joints, doctor. But that pain was not this much severe. This time the pain is like out of control. I cannot bear it, doctor.
I see. I'm very sorry.
Doctor, your voice is breaking.
And can you tell me if sorry, can you hear it now?
Yeah.
Can you hear me?
Yeah,
okay.
I can hear you now.
Okay. Is there anything that's making your pain worse?
Doctor, I'm not able to make any movement of my joint, doctor.
I see. So moving makes the pain worse. Okay.
I'm not able to move
Anything
it
that
even
makes
to a
it.
little bit.
I see. Oh, okay, okay, okay. And anything that makes it feel, anything that helps with the pain.
Doctor, I have tried for many paracetamol, but I have not found anything that is improving my pain. Please help me, doctor.
Okay, I'm very sorry. How bad is the pain on a scale of 1 to 10? 10 being the highest.
Doctor, it is 7 out of 10.
Okay, I see. It sounds really bad then. Can I get you some painkillers?
That will be very much helpful, doctor.
Okay, I'll arrange for some painkillers then. Um, okay. Okay. Does the pain go anywhere else apart from the knee?
No, doctor.
Okay. All right. And is it is it in your right knee or left knee? I forgot to ask that.
Oh, it's on my right knee.
Your right knee. Okay. And do you have any other joint pain?
Yeah, I also used to have pain at both my knee joints from earlier, but it's not that much severe, doctor.
Oh, right. Yes, you mentioned that. Okay, okay. And have you noticed any morning jamming?
No, doctor, I don't have that.
Okay, all right. Have you ever, by any chance, had any episode of painful swelling in your great toe?
No, doctor.
Okay. Um, do you, by any chance, do you have any blood disorders for which you've
No,
taken any
doctor.
blood transfusion?
No,
Okay.
doctor.
All right. Do you have any family history of any medical conditions, particularly any blood disorders?
No, doctor.
Okay. By any chance, do you have any fever?
Yes, doctor. For the last 2 days, I am noticing some fever.
Okay, I see. Have you measured the temperature?
Yeah, one time I measured it. It was 101 degree Fahrenheit.
Okay, I see. And okay, have you had any injuries lately by any chance?
No, doctor.
Okay, have you recently had any procedures by any chance?
Yes, doctor. Actually, I was having some wearing and tearing of joints, and for this just 3 days back, I had some injection in my knee joint. The doctor gave me the injection. He told me that it will improve my pain.
Okay, I see. Um, and it didn't help then? It got worse only.
Actually, it improved my pain, but suddenly I don't know out of what my pain increased, and I was having some fever. I don't know what is actually happening with me, doctor.
Okay, I see. So do you have any past medical conditions?
Yes, doctor. I have high blood sugar.
Okay. And is it well controlled?
Yes, doctor. I'm very much compliant with the medication. I do regular exercise, and I also maintain the diet, doctor.
Okay, that's great. And okay. What drugs do you take? What medications do you take
I
regularly?
take metformin 500 milligram twice daily.
Okay, all right. Have you recently started any new medications or stopped any medications?
No, doctor.
Okay. Have you changed any dose of any medications recently?
No, doctor.
Okay. Are you allergic to anything? Any medications?
No, doctor.
All right. And I'm sorry to ask this, but by any chance, do you take any party medications?
Party drug.
Party drugs, sorry. Party
No,
drugs.
doctor.
Okay. Any herbal medications?
No, doctor.
Any over-the-counter medications?
No, doctor.
Okay. And have you had any surgical procedure before?
No, doctor.
Have you been hospitalized before?
No, doctor.
Okay. Um, have you come into contact with any sick patients recently?
No, doctor.
All right. And you already mentioned you don't have any family history of any conditions, right?
No. My mother used to have this wearing and tearing of joints, doctor. Apart from this, no other family condition.
Okay. All right. Okay. Okay. Then can I ask if you smoke?
Yes, doctor. I smoke
Okay. How many cigarettes per day and for how long?
about 10 to 12 cigarettes per day for last 30 years.
Okay, I see. Well, I'd like to tell you that smoking is bad for your health, so I'd advise you to stop. And if you need any help, we can refer you to a smoking cessation clinic.
Okay, doctor.
Okay. And do you drink alcohol?
I drink sometimes at the weekend, doctor.
Okay. All right. And what do you do for a living?
Doctor, I'm a retired banker.
Okay. And this issue with your knee joint, is it causing any problem to your day-to-day activities?
Yes, doctor. I'm not able to move my leg. Right now, my
Right.
wife is helping me, but this is really affecting my daily life, doctor.
Okay. Well, we'll try our best to help you, and if needed, we can get you help from social services as well for the
Okay,
time being.
doctor.
And do you drive?
Yes, doctor, I try.
Okay. Right now, I'd advise you to stop driving until your pain goes away. And then after that, you can have a review with the DVLA.
Okay, doctor.
All right. Okay. Uh, Okay. So I'd like to examine you now.
Okay, what do you want to examine?
I'd like to. I'll start with the vitals, the patient's bedside vitals, the pulse,
Temperature is
blood
high.
pressure, temperature. Okay, temperature is
Temperature is
high.
high
Okay.
right now.
Okay. Okay, temperature is high. Okay, and then I'd like to examine the knee joint, look, feel, and
Okay.
move.
What you want to see in the loop?
In look, I'd like to check for any redness, any swelling.
Okay, swelling is present.
Okay, in feel, I'd like to check for temperature, raised temperature.
How to check the temperature?
With the dorsum of my hand, I'll compare it with the adjacent thigh and also
Okay.
with the other knee joint, with
Yeah,
opposite knee
temperature
joint.
is not raised.
Okay, all right, and not raised. Okay.
Yeah, the real patient will not be given to you in
Oh,
real
okay,
septic
right,
acids.
right. Okay, okay. Temperature, then tenderness. I'd like to
Yeah.
check for tenderness.
Before proceeding on tenderness, do you want to ask anything?
Oh, do you have any pain?
Yes, doctor,
Is
I have pain.
Okay, is it all right if I touch you there or press on
Take
your
it to
knee
the
joint?
take the permission from the examiner.
Oh, from the examiner. Okay, then
Yeah.
I'd like to examine ask the examiner if I
So
can
tell it
check for
professionally.
tenderness.
Tell it professionally that patient is feeling pain. I want to check for tenderness. Should I proceed or not? Tell it very loud and clear. Okay, doctor? Okay. 2 minutes left. So doctor, proceed
Okay,
with
I want to
gentle
check
approach.
for. Okay, all right. Okay, and then okay, all right. And then in move, I'd like to
Proceed with gentle
check
approach, doctor.
for active and passive movements of the
Doctor,
patient.
I have allowed you to check for tenderness. Proceed with gentle approach.
Oh, oh, okay. Then I'll check for tenderness.
It is painful, doctor. Anything else?
Okay. Oh, and patellar tap.
Yeah,
Tapping.
it is tap. Visible
Patellar
tap
tap.
is visible pitting formation is there. Okay, doctor. Then proceed on.
Okay. Then in move, I'd like to check for active and passive movements.
It is difficult to move, doctor.
Okay, all right. Okay. Let me join. Uh, I think that's all for examination in this case, maybe.
Okay. Proceed on.
So, can I ask what your concerns are?
Doctor, why I'm having this knee pain?
Okay, so from
Doctor, your voice is breaking again.
speaking to you and examining that you have a condition. Oh, I'm really sorry. Can you hear me now? I think my internet connection is bad.
Yes, I can hear you now.
Can you hear
on,
me?
doctor. Yeah, I can hear you.
Okay. So from what you've told me and from the examination, I think you have a condition called septic arthritis. You don't have to bother with the medical term. It basically means that you have an infection with the knee
Again,
joint.
voice is breaking.
It could be because recently you have had a procedure. Oh, I'm
Doctor, your voice
sorry.
is breaking. It is not being clear what you were mentioning.
Can you hear me?
Yeah, I can hear you now.
I'm really sorry. I issue.
Okay. So again, tell to me, doctor, what is it?
So from what you've told me and from my examination, I think that you have a condition called septic arthritis. You don't have to bother with the medical term. It means that you have an infection in your knee joint.
Okay. So, doctor, do you need admission?
Yes. Right now, we'd like to admit you and start the treatment.
Okay. So, time's up. So, doctor, do you have any diagnosis or differential diagnosis?
Provisional diagnosis is septic arthritis, and differentials could be gout, hemarthrosis.
So, why gout? Why gout? Why not gout?
There was no history of podagra or any grade 2 swelling in the past, so less likely to be gout. And septic arthritis is favored here because the patient has fever.
Okay. So whenever you're mentioning other differential diagnosis, you have to mention the points that goes against that. Are you getting it, doctor? So you are mentioning
Yeah.
gout. That I understand that you are mentioning that mnemonic of ghost.
Yeah.
That is gout, pseudo gout. Just let me make it there. This ghost part. So first tell your main diagnosis, that is provisional diagnosis. Then you can mention all the others. Like osteoarthritis, it can be gout, but against that there is no history and physical examination evidence, like evidence of podograph, no dietary history, that DHL, no defect in kidney function, no drug history I have got. So you have to tell this, you have to justify your differential diagnosis. And it could be trauma, but there is no history of trauma. Got it, doctor?
Yeah.
Okay. Now, doctor, tell me the positive physical findings.
Positive physical findings, patient had tenderness and positive patellar tap and swelling on inspection, and restricted movement also.
Okay. Now, how would you like to investigate?
I'd like to do basic investigations, and particularly I'd like to check the full blood count for any neutrophilic leukocytosis, and I'd like to check inflammatory markers as well, and ESR-CRP. And then I'd like to do an X-ray of the right knee joint, and also aspiration and study of joint fluid, and blood culture.
Okay, points on. Now, how to manage?
I'll admit the patient and we'll do basic ABC management to stabilize the patient. Then I'd like to education and counseling to on septic arthritis, and then I'd like to arrange a multidisciplinary team, and we'd start IV antibiotics.
Which antibiotic you want to start?
We can start flucloxacillin empirically, but ideally we should do it according to culture once we get the reports, or we can take consultation from infectious disease specialist.
Good job, doctor. That's all. So, Dr. Anika, are you there?
Yes.
Dr. Ani?
Yes.
Yeah. So this is a case of knee pain with septic arthritis. And for this case, unless you ask about the recent procedure, the patient or the surrogate will never give you the history of recent intra-articular injection procedure. So that's why we have to know what questions we have to ask in the past medical history. And one thing I'm noticing for the candidate that you are asking for high blood pressure, high blood sugar, high cholesterol level separately. It is actually not needed. If you just ask any past medical condition I should be aware of, this will cover all the chronic medical disease like hypertension, high blood sugar, high blood pressure, dyslipidemia, heart attack, MI, all the things will be covered up. So in the real PACES exam, it is not needed to ask them separately, but you have to ask for the surgery separately. Now come to the skills. So Dr. Anika, what is your judgment for physical examination for Dr. Shananda?
He missed the gate and planter.
Yes. Planter is it essential to check the planter here?
No.
Is it
Gate is must.
Yeah. We have to offer to check the gate. Patient may not be able to walk, but we have to offer to check the gate. Why gate, doctor? Dr. Anika, can you mention why we are checking?
The exclude cord compression.
No. To check the gate. Knee pain, doctor. A knee pain does not cause any cord compression. It is just to rule out the complications. Yeah. Any evidence, any type of lower limb symptoms coming in the PACES exam, we have to rule out the complications by checking the gate. Because we are proving in front of the examiner, we are proving ourselves as a safe doctor. Are you getting it, Dr. Shananda?
Yes, I'm getting it.
Yeah, but you did examine the you did examine the confirm the diagnosis. And also to find out the cause, you will never find any evidence of intra-articular injection punch mark. You will never find it. It will be a dummy case. Any patient with osteoarthritis who is having some mild swelling, they will be put in front of you. Because real septic arthritis patient will never be given. That's why it did not find the raised temperature. So, Dr. Anika, what is your judgment for physical examination now? Dr. Anika?
Is it borderline?
Yeah, doctor, it should be borderline. Then identifying physical signs?
Is satisfactory?
Yeah, it is satisfactory. Now come to the clinical communication skill. What is your judgment?
It is satisfactory.
Yes, it is satisfactory. She asked all the things.
Okay.
It was perfectly satisfactory. Now come to the differential diagnosis. What is your judgment for that?
Satisfactory.
Yeah, it is also satisfactory. Clinical judgment?
Satisfactory.
Yeah, she admitted the patient. She mentioned the necessary investigation and also the management. So it is satisfactory. Then managing concern?
Satisfactory.
Yeah, it is satisfactory. And I would like to give a suggestion for this managing concern. In the PACES exam, whenever we have to do any procedure, please try to tell it to the patient during meeting concern. Like for this patient, we have to do aspiration of the joint fluid. So this kind of procedure needs some permission from the patient. So a component of consent is there. He has to write signature, make signature on a consent paper. So please mention this thing to the patient that we will take some fluid from your knee joint after your permission. If you have to go for any endoscopy, also mention this, that we will do some camera test after your permission. If you have to go for lumbar puncture, always mention it in the consent part, that we will have to take some fluid from your back after your permission. Is it clear, Dr. Shananda?
Yes. Yeah.
Dr. Shananda, I'm not able to hear you. I don't know. Dr. Anika, did you get my
Yes,
point?
yes, it's clear.
Okay, is it my problem? Dr.
Can you hear me?
Is my voice audible to all?
Yes.
Okay. Dr. Shananda, I think there's some problem happening with your internet. Okay. So, Dr. Anika, did you get the point of mentioning the procedure?
Yes.
Okay. Now, tell me what welfare is satisfactory, because we are not able to judge it here. So, now tell me, Dr. Anika, what will be the total mark out of 40 from each
13.
exam? 13. Okay. So, if we calculate it into 2, it will be 26 out of 28. Which is actually good performance for the beginning. Okay, Dr. Shananda, I think your network is low. No problem. So, Dr. Anika, do you have any question from this scenario? And also, Dr. Shananda, you can type your question. Any other candidate having any question or confusion from this scenario?
Sir, I want to ask something.
Sure, doctor, please proceed.
Sir, patient said that he has severe pain, that he couldn't even move his knee joint, I mean leg. Then
Good
can we
question.
offer him to perform a gait, or I should ask to examiner that
Yes,
he has a
we have
severe
to.
pain?
Yes, we have to tell it to the examiner that I want to check the gait. Is it
Okay.
possible? If the examiner will tell you no need, and that's how he will give you the mark for checking the gait.
Okay, sir. And another thing, sir, in examination during crossing with the examiner, can we say a short form, ABC, or I should say the airway breathing circulation, full form? Is there any problem, sir?
Better to mention the full
Okay.
form, because this will take some time and you will save your back. Because if you complete your answer of the investigation and management earlier, the examiner is not going to stop there. He will continue asking all the questions. But if you can reply the investigations and management in professional way, most of the time you will get full mark, even if you are not able to answer all the questions. This happens for multiple times. but you will have some anxiety inside yourself. Like you think that I have not done well in this station, and that will affect your next station. That's why I suggest that always give the answer in slow and steady way, and give the answer as much indirect way as you can, just to kill the time.
Yes, sir. And the last thing, sir, if I'm not wrong, patient said that earlier he has both knee pain, but right
Yeah.
now his right knee pain is severe. So
Yes.
that was a red herring, or sir, was it
It's
an
red herring.
important issues? Red herring.
Yeah.
Okay.
Earlier she was having osteoarthritis. So osteoarthritis usually presents with asymmetrical knee pain. So she was having knee pain for that.
Yes.
But right now the pain is very much severe. It is not like that osteoarthritis knee pain.
Okay. So yes, understand. Thank you, sir.
Okay. Thank you, doctor, for asking the question and making it clear. Any other question or confusion from any of the doctors? Okay, I think no confusions or questions are there. And only 2 candidates are there, and they actually have joined yesterday. So that's why they have not gone for the homework and they will not practice today. But from the next session, they will also practice. Rest of the others are completed. And that's all. We have completed our today's practice session. So doctors, for the registered candidates, now your homework will start for the neurology part 1. So first you have to make notes for the prompt session. Then you have to cover the cases from case number 1 to case number 35. You will be given access to the video recording with Jive link until the website start functions. It will take 1 more week. So all of you will be given access of this 35 physical examination, investigation, and management review. So please complete making your notes. Then you have only 2 to 3 days to complete all the notes. Then you have to start mutual practice like today's session. So that's all, doctors. That's all for today. May I know if anyone has any other confusion or question? Any type of question, doctor? One of the doctor asked, what is the pass mark of LCC? Actually, doctor, there is in the PACES exam, pass mark is not counted based on each station. You have to pass for each skill separately. And in long clinical consultation, actually, all the 7 skills are assessed. That is equal to pass in the PACES exam. You can even pass the exam by missing 2 short case stations. If you can crack full mark in 2 long clinical consultation and both the communications, it is possible. It has happened to many doctors. But the most important vital stations are long clinical consultations, then communications. So that's all for today. And this is the last free practice session that was open to all and to ask the question. And we will start our next session. Yes, doctor?
Sorry, sir. I have a question regarding the mark distribution. If any candidate get the unsatisfactory in any one of these 7 category in long clinical consultation, does it mean that he will fail?
No, doctor. Because each skill is there for each of the station.
Okay.
Not all the skills are there. Like this clinical communication skill, you will not find in the short stations because this has some component with interaction with the patient. But there's a certain pass mark for clinical communication skill for passing in this skill. So it will be counted overall.
Overall. Okay, sir.
Yes.
Thank you.
Any other questions, doctor? Okay. So from now on, Dr. Shananda, you will practice with Dr. Anika, and Dr. Anika has to practice with Dr. Shananda. And you both have to report me 2 days after completing the notes. Are you getting it, Dr. Anika? Dr. Anika, can you hear me?
Yes.
So you have to practice with Dr. Shananda, and Dr. Shananda has to practice with you like this way. All the things are there, all the case details are written there. Using this information, you have to practice like a surrogate and provide the judgment using the marksheet for each other so that you can become a mentor. You don't have to depend on anyone else. And that's all for today's session. Hope to see you all in the next session. And thank you. And thank you for attending. Thank you, doctors. Goodbye.